Still have like 30 seconds.
Yep. Oh, I got your. So if you haven't, please mute your phones in the intro. With that, we are now right at 6 o'clock. So I believe first up is roll call.
Will Garrett,
I am here.
Jeff Perry,
Here.
Mandy Lewis,
Here.
Rob Wilkerson,
Here.
Mike Mills excused, Aaron Delstardar,
Here.
and Isaiah Johnson is also excused.
Okay. Okay, real quick.
As far as I know,
Yeah, well, first, I'm just real quick, so you do not exceed the max capacity of the room, so from a fire safety perspective, we are safe. So you're gonna make a motion on the approval of the agenda, I'm assuming?
please.
I'll second.
Any discussion on the agenda? All in favor?
Aye.
Motion passes, the agenda is approved. PAC members, are there any conflicts of interest on tonight's topics with any of us?
Nope.
No here? No all the way around, all five have no conflict of interest. Next meetings is currently scheduled is September 15th and 29th. The first is a public hearing and the second is a follow-up. Staff will give us more details here in their staff updates. And on that, committee and staff updates.
So like you said, September 15th, public hearing, that would be to take public comment. If we don't, and then the September 29th would be for deliberation. Regarding the public comments at that meeting or any comments that we receive in writing.
Just remind me to write it down. Okay.
Well, what are we over here? We don't have anything on this case. It's a grant.
So, for tonight, because we're not going to take public comment, it's just really, here's, with the exception of transportation, here's the full draft of the comp plan. Plus we are set a separate work session to talk about the health and human services section. And because there's a lot, it's a huge document, there's a lot going on. Prior to the September 15th public hearing, it would be really good for the planning commission members to focus on the things, and I appreciate, we saw comments from both Will and Randy so far, so I really appreciate that. But to focus on like the technical and formatting corrections. So if you see things, many eyes on the same document is helpful because people will catch different things. So it's good to just, technically go through that, get all of those out so we could be making those corrections. And if there's gray area, people don't agree and whether it should be corrected, that's a good discussion to have. And then there's like statutory requirements. So, you've heard multiple times, and this isn't 100% of the time, but our board likes to meet the minimum standards set by the state. It's mostly a resource issue. Sometimes it is a political issue, and opinions of the board. But a lot of time it's just for resource reasons, the time, the staff time and money that it would take to do additional items. But then also the board has asked us to do things that are not state mandated and required. So, there's always some flexibility in that. But so to talk about anything, if any of the PAC members have questions about the statutory requirements, we got Kirsten here, Marissa and I, between the three of us, we have many decades of experience working in Washington State Growth Management, Department of Commerce. We can help answer those questions. And then lastly, it's that those, the the policy choices. So we get the goals and policies and kind of what Dave Wyndham from, and I don't see the right here, but, the departments and NGOs, non-governmental entities, we use the comp plan to set forth going after grant monies at the state and federal level. And, or our local NGOs will use the comp plan as a policy group to go after funds even at the local level. And then we also set it for our zoning and development regulations. So things that, this is guides the policy, then our development regulations, which as a permit plan or current planning, that's what we use on the day-to-day basis when we react to developmental proposals from folks. And so this document guides the actual regulations ultimately. And so you really want to focus on those goals and policies and what those say, and is that reflecting the value of the PAC? And then of course the board will end up adopting that as a reflection of the board and kind of where they want to go. So I will say that I will caution that I think it is an inefficient use of time to talk about statutory requirements that you may disagree with. I, for one, disagree with a lot of things that the state requires us to do because I have an opinion about whether I think that would be effective in real life and how it works in the planning world. But the laws have been passed and they are what they are. And so, we talk about it in the office and especially during the legislative sessions. Dave knows when legislation is in session, all of our departments are weekly keeping in touch with our cohorts to talk about, making a bill better or killing a bill or making sure a bill gets passed. But once it's ultimately passed, it's kind of inefficient use of our time at that point to really be angry about it. And so I just, in reading some comments, it's I don't agree or disagree, or maybe I do agree or disagree, but it's the state's requiring us to do this, so we should just accept it and go on. That's it. That's all.
Okay. Any updates from the PAC committee members? Right. Other business, I see nothing on the agenda. Leave it at that. We do have public comment on the agenda, so with regards to that, because it's on the agenda, I will open it to public comment. But for things not on the agenda, and giving the comp plan is the agenda, that's rather overarching. So if you have something not associated with the comp plan in any way, shape, or form, we will listen to that public comment. Does anyone have any public comment? I know,
No, you're right, you're right.
It's on the agenda and I don't want to, I want to give public, anyone in the room? Yes, ma'am.
Hi.
Got the timer, all right, thank you.
I'm Julianne. I live in Belfair. And I just wanted to appreciate all of you who work so hard. The work that you do is very important. I won't mention any particular type of work to respect the guidelines. But I have gotten to work with staff members about things totally unrelated to the agenda, and they've been kind and helpful and given a lot of time. And I know they do that for other people too. And I just really want to appreciate the hard work that you do, given all the forces coming at you. I really appreciate that. I would appreciate you PAC members for when you listen to public comment and consider things carefully and you try to think about what's best for our shared community and the best ways that we can get there. It's not an easy job. It requires a lot of hours, and I really acknowledge and appreciate your labor. And I want to appreciate SCJ Alliance and the consultants. Hours and hours and hours of a huge amount of work. I've, written 40-page reports. I have not written a 300-page report. It is a lot of work requiring many, many moving pieces, many different personalities, and there's something really beautiful about lots of different types of people coming together to to build something that's gonna set us up for success in the future. And I'm glad that I get to witness the kinds of leadership that exists. Thank you.
Thank you, Ms. Gill. Anyone else in the room? In Zoom land, is there anyone in Zoom land that would like to make a public comment on a topic not on the PAC agenda? Being the comp plan, something other than the comp plan topics? I see none. Therefore, I will close public comment. Thank you very much. All right. One clarification, and my apologies for not bringing it up during staff updates. I did get a call from Loretta Swanson earlier today. She has a family engagement and will not be here tonight. So if you did give me a call, asked if I had any questions. So all right, with that, we will move on to the work section, Health and Human Services Staff Report.
Hey, good evening. Mr. Talking over your shoulder. Dave Wyndham, Mason County Public Health and Human Services. First, an apology. The document you got late last week was not the correct document. It had a nearly identical name, so you should have got a document this late this afternoon and went out, right?
I brought a paper copy because
Okay,
I failed to send it out.
okay, I got it.
And that's my.
Fine. I thought it, we'll send me some questions on something. I'm like, wait a minute, this is not what I. So,
No, I
Forgot it.
you got it? You guys got it?
Yeah.
Okay.
Yeah, it's done.
All right. Okay, so we got,
I'm assuming no one has reviewed this.
No. Actually, you reviewed it.
But it looks familiar to the first round.
It's similar to the first one, but this one I actually presented last time I was here.
It's the. It's the.
So you've seen it before. Some things that got incorporated. I went back to the purpose statement, which you'd asked for. I made a change in environmental health. Section 1.1. Which is actually a very important one. This was brought up by next QD1 in first sentence. We did used to have a period at the end of the word protected, added the word from contamination because protected is not if the bigger things, but what environmental health does is protect from contamination. So it's we slimmed that down. We did take into account some of the things we brought before the word ensure. So we left ensure in those places where the RCW requires us or WAC requires us to work on something. We use the word assure, those things that are dependent on that we have times and budget to work on those things. So it's just not as constrictive as the word ensure. So those are the main changes from when I was here the last time. So I'll just a ton of grammar of those. Animal questions?
So questions the PAC and with respect PAC, and if I'm going to spend at least 5 minutes or so sort of standing the document. If you have a question, just speak up.
Yep.
I'm looking at health outcomes. You remember first bullet,
Oh, that sounds good.
you're saying 7,600 years of life lost. So
You
that's
should know how to-
7,600 out of how many?
Okay, so the way that's measured is if someone dies over age 75, they're expected to have completed normal life. If you have somebody that dies at 30, they've lost 45 years of expected years of life. So that's how that's measured. So how many years have we lost of people who've passed away before the age of 75?
So that's 7,600 in the county.
Yeah, I think
Well, that you just added up for everybody.
Mhm.
Since
Now,
the
what-
state's only 5,500, that seems like some difference.
So this would be 7,600 years per year's life per year. Under the age 75?
Yes. Yeah. So our community actually looks good the problem is the way it's measured. They don't give us credit for anybody that goes over 75. Okay? But they do count against us anybody that dies before 75. That's where it looks off. We have a community that lives to a pretty darn good old age. I mean, we've got lots in their 90s and even low hundreds. So, but we don't get credit for that. That's not how the state measures.
I'm assuming this is some construct of a weighted average.
Mhm.
I mean, if we have. We have 7,600 years a lot, we have. We have 1,000 people that die 7.6 years early, 7,600. Okay, but the state has less loss than we do, and yet we're part of the state. How does the state get to a lower number? I think that's what you're.
What they do is,
Yeah.
is they
It
include a
seems
lot.
like it's
You know,
kind
you've
of,
got counties, for example, San Juan. That look really good in comparison to Mason County.
But they can only have a negative number because we don't
Right,
give
because
credit.
they're not contributing to the big negative number, and we contribute.
So this is some construct of an average. That ought to be stated in here, because I'm confused too.
no, you actually just occurred to me based on what you said. So it sounds like the 5,500, each county does the same thing. And their average is 7,500 compared to our 70, yeah. I think I can,
I mean, pull this number from a document it's called County Health Rankings, where they rate each county against each other, and then they do a roll up for the state.
but the method's the same. They add up all the lost years in the county and then divide by the number of people in the county, something like that.
Right.
I wonder if they include people over 75 in what they divide by.
Well, yeah.
I guess they're all zeros.
It's an age balance, yeah. It's age adjusted, but.
So what you're saying is it's an actuarial dream.
Kind of, yeah, yeah.
You got it.
But it is interesting because we're an older community. And all the old people, their number is zero.
Right, so anybody that's over, yeah, like I said.
That makes
don't
me
get
wonder
credit
if
for
you're dividing the total lost years by the number of people in the county. Are the people age 75 included in the denominator,
those.
basically?
No, they're not.
Okay,
Below
okay,
75.
that makes more sense.
I was reluctant to put these data points in, because data points change over 10 years. But as we talked about last time I was here, we need a place to start.
Right.
That's what I did. There's some starting points in.
Thank you.
Yeah. And those will change as we adjust the health department's strategic plan.
Change is not the problem, it's know where you are.
Yeah, exactly. And that's the thing is finding your trends. Trends are the big thing that I want.
Hey, too. She's got some data there on the.
Okay, so it's per 100,000. So what they did is they did an adjustment across the state.
I wouldn't.
And actually, as of next year, we won't have that resource. Health rankings are going away as of January 1. We're not gonna be measuring counties against each other.
Will the data be available to where we can mark ourselves? We can track the changes that occur within our jurisdiction.
Yes,
Okay.
so we'll have access to that data. And we now have an epidemiologist on staff who to do that.
Okay.
So we'll be able to keep an eye on our trends.
Right.
Okay.
So. I unfortunately don't have this electronically, so I'm going to bounce between a couple of things here. In what was sent, we talk about genomic data and predictive analytics.
And that's out.
That's out. Thank you. Okay. We talk about.
Yeah, you had highlighted another one.
Yeah. At one point, there was a discussion of potentially testing private wells. Is that discussed anywhere in here?
No. No.
Thank you.
I mean, no, it's not. Group B's get tested. private individuals do not.
Yeah, the way, the draft that was sent, the way I read it, was that there was a, to help protect individuals, there was potentially an initiative to test private wells. And I had, thank you, that's not in here.
It's not in.
Okay.
Now, the one time a private well gets tested is when it's first put into service. They do a nitrate in the fecal coal.
And also many times when they sell the house.
Yeah, that's not required by us, that's
No.
required by usually by the finance company.
Right.
Seems like a lot of what you're talking about here. It's good it's in there. It seems like all the things that affect people's health that you're listing.
Mhm.
Especially the health department doesn't, has no control over it necessarily.
No,
It's
not-
not a criticism, I'm just saying, like, how can we affect the schools, how do we make sure that, there's healthy food and all that?
Well,
kind of
actually, we
stuff?
do work with them to work on their menus and get better menus. And
Oh, okay,
so we do that. For example, we work with the hospital, and the hospital changes its whole food menu, and they're using locally purchased or locally grown vegetables, things like that in their foods. So
but there's things like air and water quality, housing, transportation. I don't know, maybe you're involved with that too, I don't know. It's just an observation, it's not a criticism.
Yeah.
You have a very comprehensive list here, which.
yeah,
I thought was
we
good.
touched things like transportation. We had a project we did a couple of years ago, and it just didn't work. Just to be honest, that particular pilot program didn't work, and we discontinued it.
Facilities for physical activity. That could be, my mind could be changed, but it seems like, especially if you're not talking about the county, not Shelton. Facilities for physical activity.
Okay.
I mean, there's like tons of trails already out there, right? It seems like there's other things that have higher priority.
Which number? What are you looking?
I'm sorry, that's on page 7 of page 7.
So
It's the,
I got it. Thank you.
yeah,
okay, so I'm gonna jump to the county health rankings. We look really bad in county health rankings. That's why I left it out of this particular piece. Because county health rankings only shows as access to physical activity things as gyms. As a place where people can go and work out. It discounts trails, fishing, hunting, anything you might do outdoors. So we took that piece out because that would discount a lot of Mason County. It just doesn't make up for what we have in the rural lifestyle. So we kind of left it a little more broad than that, just access to physical activity. We got a ton of people walk, especially around Island Lake. That place, people are walking all the time.
How much influence do we actually have on public schools? How do we change the PE requirements? That's goal 2.3 on page 17.
Really, it's a matter of just approaching school boards. And I did a study on this.
Is it a school, I'm sorry,
It's
is it a school board decision?
A school board decision. And if you look at how things work in the schools, the biggest barrier I have is an investment in the status quo. The school systems don't like to change PE schedules. They don't like to change. They're very invested in the status quo. That's the toughest nut to crack is how do we work with the schools to move those things in a different direction?
I'm sorry, I didn't get what you were saying, the schools board decision is what?
There is a policy that says the county will promote enhanced school-based physical education. So I'm wondering, how does the county
So we'll,
try and
Yeah,
influence, promote a public school?
so we have a nurse, and that's part of her job, is she works with the schools and other organizations, not just schools, just everybody on physical activity and healthy eating. That's her sole job, is to work with different organizations on improving those. So that's what the county is.
that was sort of my general point, though, like, a lot of these organizations that control these things. We encourage healthy stuff, but we're not necessarily directly involved.
Right, so there's a difference between, the coercion aspect of public health, where we tell you what you have to do, and the educational encouragement side of public health, and that's where we really try to put our efforts as well.
No, that's good, that's good.
I think too that. And I think it's a fine line. Where are we stepping on someone's individual rights? Okay, and I see when I scanned, looked at the item over the weekend, I saw the statement. Let's see, I think it's back over here. Oh, yeah, we want to be tobacco and smoke free. Why not cannabis and also alcohol? And I'm merely saying that because when I look at a pack of cigarettes, when I look at a bottle of alcohol, both have a statement by the Surgeon General saying they may not be the best for your health. Everyone can have their own personal choices. I am not advocating that we ban those in Mason County. I am not advocating. I want to be very clear on that. But I see we have, we can't use any tobacco product and don't smoke. Okay, and who are we where is county government to say that?
It's Board of Health. Board of Health sets those priorities for department, or for public health department, not the county commissioners. So a lot of people understand is we work under different lines of authority. So you have a line of authority that comes from the state constitution to the state board of health, to the local board of health, to the health officer, to me and staff. Over here. Or here you have county government, which drives theirs from the legislature, county government to us, two different lines of authority. So what we're talking about here really goes through the Board of Health piece.
That's just how it's organized.
That's how it's organized. And that's especially came into effect after 2 years ago when they reorganized how boards of health are done across the state.
Well, are you implying that the statement implies that, just an outright ban in the county of alcohol?
That's how I'm reading it.
Yeah,
It says, quality and sustainability of the environment, tobacco and smoke free. Period. There's no quality. I believe this would violate personal rights. I believe it violates the Constitution. I'm not a lawyer.
But we don't say force. And there are places, any organization, the hospital, in the county, whoever can say, this is a smoke-free facility, period.
but that's different than outright.
That's not me going in and telling someplace that they're smoke-free. You don't do that. Now, we do have to do things where you have the indoor smoking rule bars and that's our.
Right, you can't drink and drive, all that, but I agree with Will, maybe that needs to be more specific, I don't know.
I guess I struggle with this and that. So many of the sections are required to have basically what's, price tag to each item. So what's the price tag to some of these? And I think some of these are, I still believe that a very clear social contract ought to be in there. What is our expectation? Do we expect individual accountability, or do we expect that I can do anything, but then ultimately society will forgive me and cover? Well, society will cover for me, regardless of how poor my decision making is.
So I dug into that a little more. It has to be more of a quid pro quo. There's got to be two sides of a contract. And what you're talking about is just a one-sided contract. And I was unable to work wording on here that would really make that work.
It's
You know,
really hard.
it is.
Yeah.
So I looked at that, but I asked other health jurisdictions how they were doing. And really, they limit it to just if you're receiving housing assistance or something along those lines. Then there's a two-part. You get something, we get something. There's an expectation you get this, expectation we get that. On general health, you can't do that. There's nothing to withhold on your part of the contract. That's for your medical insurance to do. You know,
But it's,
you've got a lot firmer grip on that than we possibly ever could.
Another question, is that okay, or you're still thinking?
knock yourself out. I'll be thinking for a while.
Okay. I just noticed a bullet says that adult obesity rate is 33% compared to the state's 27%. I just wonder is that in part because we're an older community? Because the older you get, older people tend to be fatter than younger people. It'd be interesting to see that graded by
Yes and no.
age.
If you take obesity and you take overweight together, we're at 66%. So 2/3 are overweight or obese. That's not that far off of what the state is, and it's well within the margin of error between the two.
I'm just wondering if that's one of the drivers, the fact that we're.
Yeah, I mean, older, more sedentary, you know, that's just.
So
part
does
of
this
it.
mean that as a group,
You will also find that people in the rural areas who drive more to get to things will be more heavy than people who are in the city and walk.
or like me who drives to my mailbox?
So we talk about, in here, we talk about access to medical care, physical, mental, dental are the three that typically stand out. And, there's almost appears there's an assumption that the care is available. And I'm not convinced it is. You know, particularly mental health, I have read in anyone that says we have adequate mental health providers at the county, state, or federal level.
There's not a strategic stockpile of qualified mental health.
Right. So when we say access to, part of that has to be creation of. And no, I don't think we as a county necessarily should take that on. That maybe if you're King County, but not Mason County.
No, but that is something that the public health system is working on, that workforce development, building those pipelines.
It can always refer you to somewhere else.
For
Come
mental
on,
health.
Lacey or Tumwater.
Yeah.
And frankly, one of my goals is to keep healthcare accessible in the communities where people live. And part of that's a very solid economic reason. If someone goes to another county, say to get maternity care because it's not available in their own county, it won't be long before they move all their health care to that other county. Now that starts to spiral. Fewer services are offered, hospitals retract, nursing homes retract, and eventually you lose them, and you lose that anchor for the community. So our goal is to keep our local health system as healthy and vibrant as possible. Keep those dollars here and people getting access to care. We eat on those things all the time with the hospital. And Peninsula Community Health, those are up north.
Yeah, I was talking to Eric a couple of years ago. Apparently they track like who in the community goes to which health providers. Like there's a certain amount of people in Hoodsport, they go to Olympia, they don't go to Shelton kind of thing. So I haven't seen updated numbers yet.
You have to think,
I don't know if that's
kind of
improved.
best educated guess. How many people are in the community? How many people are accessing the system we have here, and then deduct the difference? And then try to account for people who just don't access the system.
Okay, on page 12, goal 1.5. Is that recommend second sentence that starts 1.6?
Oh, yeah.
Is that supposed to be there or just
No, that's error.
That's okay.
I think it never was.
I didn't think it really meant goal number 1.6, but.
Yeah.
Okay.
How much of our county does not have medical insurance?
Well, you figure fully 1/3 is on Medicaid. So that's
Wow.
probably our largest. And then it's right in with private insurance. So in the other 2/3, you've got those other pieces of, uninsured or you're insured by the military. Those are things. I'd have to look at that, but it's in that last third.
How much is Medicare?
Medicare's runs about 12%. But that's also hard to measure because you got people on Medicare who also have, TRICARE for life and other things as well. And it all depends on who the hospitals are reporting as
Medicare, how many are on Medicaid?
30%. Typical.
That's the 66,000 people total. That's populated.
So we have 20,000 Medicaid.
Think about it at the state level, same level. So you're talking about 2.5 and the 7 million.
So 12% of Medicare and what was it,
30% Medicaid.
Yeah.
so does that mean 42% on one or the other? Is that right? Or are they commingled somehow?
Well, some of them are commingled.
Okay.
So you have some people who have Medicare and
Reason I asked who's uninsured is like, immunizations are available for all. So I just assume if you're insured, you have access, whether you use it, separate issue.
Right.
That this is access.
Yeah.
But we're saying that, roughly 1 out of, how many are uninsured?
I can't go back and look at that, but you've got people who just don't have insurance.
About
They truly don't want insurance.
But if
They don't, they're not participating in any kind of insurance. And some of that is my choice.
and that's where I was headed. And this is a fine line is, who are we to mandate medical insurance? Who are we to mandate medical care? That's really where this is headed.
Well, I think you had a drop off after the Obamacare removed the penalty for not having, in some system, you saw a drop off of people who just choose not, they self-insured. For lack of a better term.
Kind of the ratchet effect, because young people have nothing. I don't need to buy Obamacare. I'll go to the hospital. If I declare bankruptcy, it doesn't matter, because I've got nothing anyway, so, it's kind of a ratchet effect with higher and higher wages.
So with regards to nutrition and goals, following with page 15, top of 16, we've got 2 policies here, and these seem to just talk to helping support availability of nutritious foods and focusing on that. I don't, and this is the question, is there anything in here, the other version that was sent out had terminology dealing with working with restaurants, I'm thinking also food trucks and mobile vendors on providing better healthy choices. I don't see that specifically called out.
But I kind of flatten that a little bit because
Thank you.
we're working, for example, with the correctional facilities to pick up, they have a huge garden. And they overproduce. We're looking to pick up all that excess and run out through WIC or YMCA or the food banks.
Well, I guess where I was driving with the comment, my thinking is that, what I choose to eat is my choice. And I get the effects of that. If I go out and exercise and eat well, I get a certain result. If I don't and, eat fast food, eat fat fried on a daily basis and watch a lot of TV, I get a different result. But those are my choices.
We're trying to utilize the resources that we can find to make it easy.
Kind of a general comment.
Mhm.
And applies to the rest of it too. It's just me, I see words like assure and ensure, like. I mean, can we absolutely guarantee we can do this or that? I mean, there are a lot of the goals and you try to achieve the goals, depending on our resources and all that, but all throughout here, I see that several times. It just makes me personally uncomfortable, those words.
So I'll go back over it again. So we use the word ensure on those places where the RCW or the WAC requires us to act in some way. And use the word assure in those places where we can work on these things as time and money and staffing are available. Because assurance is part of the 10 tenets of public health. It's always going to be in the things that we work on.
But do the RCW say you absolutely must guarantee this or that? Or do they just say,
Well, for example, it says you will ensure drinking water is safe. That's part of the job of environmental health.
that's true.
Surface water.
There's some
is safe.
things that are given, right?
There's some things. So if you look at the things that we're basically required to do, anything that you can accidentally bump into that affects your health, food, air, water, those sorts of things, those are typically in the insure category. Where those things on food and healthy foods. Safe foods. Safe foods is a requirement. Healthy foods, that's an assure. We will work to try to make that as available as possible, but there's not a guarantee on that.
So it's here, assure, it's like, we'll try to make it happen, but we can't guarantee. Okay. But yeah, you're right.
So it's shown as a priority.
Yeah, I mean, you want to make sure septic tanks aren't failing and
Right.
clean up. Yeah, no, I get it. Thanks.
And that was out of your comments from the last time I was here. So I went through that in a thoughtful way to try to make sure I could split those hairs.
No, that was good. I appreciate it.
Yeah, there's things, but it's like, I know we're not gonna be able to tweak it.
I guess my comments would be this couple is that I think it would be helpful for citizens as they read this, if they understand that certain things are mandated by state via the public health chain of command. And therefore, if you will, but more importantly, the Board of Commissioners for these limited elements have no authority in the requirement. They may have and likely have total authority with regards to allocation of county funding. But with regards to the requirement, it's driven from the state to the public health chain of command. I think that would be very helpful because there are some, like, again, I'm going to go back to tobacco and smoke free. That could be a lightning rod for some. Okay. And just in defense of our county, your office, our Board of Commissioners, we should say that is mandated by the state. If you have a question, we'll give you the phone number of the Department of Health at state level. And then I guess in this let's throw this one out. We use the term and resources are equitably distributed. Somewhere, and this applies across the plan, we use the term equitable a lot. But what does that really mean?
Let me tell you how I do it.
And ultimately it's going to be bigger than how you do.
Right, and I've had trouble with this at the state.
Yeah, no.
Because the state has its own definition, I have one.
Yeah.
And my definition is, I go where the disease takes me. It's very simple. I don't care what population it's in, I go where the disease goes. So that's where an equitable distribution of fitness goes to the places that have the most risk. Wherever they happen to be. And right now, we've got a lot of problems with tuberculosis. We're spending more resources on tuberculosis work than we have in the past. In the past, we used to get one case a year maybe. And now we're having 5 or 6 every 6 months. So the problem is different. So we reallocate those resources towards the disease.
At one point. You know, in the document, we're not.
You're on page 7.
Page 7 of 17, where it has housing. And throughout the document, we're not really, I'll use the word critiquing what drives or affects people's health. But here in their housing, which I don't disagree that it does affect, but we don't say other things about nutrition things, or we don't say other things affecting people's health, yet we'll say it here about housing. Does that make any sense what I'm trying to say?
Well, okay, so housing is one of those pieces in that whole page of built environment,
Right.
access to healthy food, physical activity, water, housing. Those 4 things are all included. So it's not separated out. It's just there's a blank spot on formatting.
He's connecting all this into one section here,
Right.
under this primary heading.
Got it.
And arguably, while we talk food, physical activity, water and housing, as other discussions have gone down, we could also talk about educational levels. We could talk about the community you're living with, the economic environment you're in. What is that annual mean income, and what does that mean for the opportunity to do some of these other things? We could.
Yeah, and I talked about that earlier on in the document.
Okay.
Yeah.
Obviously, we haven't had a chance to read it.
So, yeah, when you go to the social determinants, it talks about all those things. In fact, on page 5 of 17, you see what is a healthy community, and that's where those things are probably listed.
Well, there's another word I'm kind of wondering about, which is the word fair. Not exactly.
I'm trying to point that out. Because fair is a debatable.
Yeah, probably not your document.
You saw it in the other
Oh,
one. I saw your notes.
Okay.
You saw it in the other.
Oh,
You had it in the other document.
yeah, so no, yeah.
So, folks, my apologies, PAC members. Thank you. I just asked Mariah, where are we on sort of the 30-minute discussion? And she said, well, technically you're still on questions. Well, fair enough. So, so you were discussing the comment of the word fair, and did you get your answer? I think.
Yeah, he tries to avoid it.
Well,
Because fair is a
I have
very
seen it.
big concept.
I've seen it in the other
He
document.
doesn't want to step on the landmine, okay?
other questions?
So. What was an
With that, do we want to move on to PAC discussion?
Sure.
No.
Okay.
Thank you. Yeah, don't go far. Dan. Not unlike us to throw a question back out.
I think the last time we had this before us, we kind of beat it up. It was one of those things that we weren't happy with, but had to, we were tasked with putting it into the comp plan. And so we tweaked it, or hopefully got tweaked to get better, to better fit the comp plan. I don't know that we've done that because I haven't brought that all the way through from just reading tonight.
Yeah, we're scanning it.
Yeah.
Well, and say that for one thing, it's certainly a lot less pages. So if something happened between then and now.
Randy, thoughts?
No, I'm good, thank you.
I guess my thought is, I keep tilted in her intro said, remember that focus on goals and policies. This is an opportunity to potentially seek federal or state funding, both as a government. It also helps and supports our nonprofits and other entities as they look at opportunities to help and serve our community. I struggle in the sense that, are we all pulling on one end of the rope? Are we pulling on both ends of the rope and in opposite directions? And there are times I wonder that, and that's sort of why I tossed out that social contract in the sense of, could we align? I understand that very quickly gets into politics, okay? And it's very difficult to do, and it can very quickly also step on individual rights, and I absolutely do not support that. Another element of this is I definitely think we need to segregate out what's public health driven versus what's in our control to define. For most of this, we are required to put cost estimates in. And, there's nothing here. It's pretty open-ended.
What about cost estimates?
Well, for most of the projects, you need to put a cost estimate in.
No, we do not. In the capital facilities for a
Okay.
6-year tip, but your
No,
comprehensive plan elements,
Okay.
there's zero.
all right.
No, that's
Oh.
not.
Well, one basic question is, if this was not part of the comp plan, what would be the consequence?
It's
It's not required.
that is correct. And so when Dave was here, I think 2 meetings ago, and he presented it, he's presenting it as just like the PROS plan, the park plan, which is and the economic development plans. These 3 together are optional. And Dave is bringing this forward. He did the work. And I assume Dave's talked to different Board County commissioners and has a level of support that he can assume that if it goes through the PAC with one recommendation or another, that the board will hear the recommendation.
Right, and we have used this in the past. Maybe it's been in comp plan the last 2 iterations to take the comp plan used. And it's been an anchor point for, say, a group that wants to do something that you get the question, does this align with your comp plan? And if it's not in the comp plan, not attached to the comp plan, the answer to that is no, and it puts in somebody else in a better position to receive those funds or whatever the project is.
So like with the parks where we don't put the whole parks plan in, but we reference it. I mean, is that an acceptable method to working? There was the parks department creates, their sub parks that, their document. But in my understanding is the way this comprehensive plan's coming together, we're gonna have that chapter 8 or whatever it is, and it's gonna maybe be 1 or 2 pages, but it's gonna reference that other plan and then leave it at that. Does that facilitate or work with Department of Health or not?
So Dave happens to be updating this Health and Human Services element of the comp plan at the same time that we're adopting that we're updating the main plan. The parks folks and back then Mark Neary, as well as the county administrator, they just said we are not updating this at this time.
Oh.
And then the economic development chapter, we also agreed in advance we would update that element with the help of the EDC. But this just happens to align with it, but it can be referenced just the same way, there's a page that says parks and a page that says one of the others. You have a page that, because formatting is different, so that page in our comp plan just refers to chapter 11, the health and human services element. And Dave can update it at any point in time, separate from the full comp plan update. So we are on now a 10-year cycle. So for 2025, the next update of the 20-year plan will be 10 years from now, 2035. So maybe Health and Human Services doesn't get updated at that point in time. It might be delayed, or it might have gotten updated earlier. That's up to Dave or his
Right, we do
predecessor.
periodic strategic plan updates because when you get into the weeds, into the nitty gritty, which this does not, this is high view.
Right.
The, strategic plan, we don't go any further than 3 years because we have found that if you try to do a longer projection than 3 years, you're out of date.
Yeah.
The conditions will change, legislatures change, governors change. So we try to keep that into a shorter, update period. Do it more often and keep the data on that correct, and just use this as the overall, and we'll refer to this in our, strategic plan.
So,
It would seem awkward to have them refer back and forth to each other.
I don't have, I mean, I understand what you're saying, but we have, and I understand what was said with regards to the first plan. I'm a little confused as to which approach to use, because it seems like the reference gives you the ability to update your plan anytime and bring it back to the board, whereas when it's going through the comp plan update, it's once every 10 years or whatever. Is that?
So,
The required update will be every 10 years for the required elements. The ones that are optional, we're not bound by those required dates because they're optional.
Oh, okay, fine.
Well, I think,
So is it fair to say that
Yeah.
with the comp plan referencing or incorporating chapter 11 HHS stuff, that it makes life easier for near-term and long-term funding sources, activities? Like grants?
yeah, how to respond to that. So having in the comp plan makes it easier.
Okay.
It makes it much easier. And that's it's not just state and federal funders, it's private funders that look at that as well. So, and that's some of the areas that we're reaching out to in other ways.
So if it ain't there, it makes your life more difficult, but not impossible.
Not impossible, but more difficult.
Does this exist in other documents?
What's that?
That, like the Prost is a standalone document that's been incorporated by reference. If
I
this
say
is,
it's incorporated by adoption. It says in here it's adopted by the planning commission.
Adopted by reference.
okay,
I think so, right.
does Health and Human Services have a
Nope, you're
stand? Does Health and Human Services have a standalone document that covers these topics?
We have a strategic plan which we used in, and we break that into six month or 1 year work plans. It's a very granular document. This is the think of this as the mission statement, and the other one is the execution statement.
you're talking, oh, I'm sorry, go ahead. Okay, thank you. You're talking about the required 10-year review. But I think I was told early on that like annually or something, there's the opportunity, if you feel you need to, there's the opportunity to look at it and make tweaks, right?
Yes,
If-
so,
yeah.
once our comp plan is adopted, then we can make comprehensive plan updates annually if requested. We rarely do them, but sometimes, things come up and so you make a comp plan amendment, and it only can be done once per year, so typically, in the early days of GMA, that happened more frequently, but now that people are used to the comp plan and whatnot, it doesn't happen as often. And then, of course, the transportation and capital facilities gets updated annually because of their 6-year SIP and TIP.
Okay, that's, yeah, you had told me that a long time ago, it's okay.
I'm comfortable.
Just a couple of questions. We cover topics like physical activity, nutrition. Where is homelessness addressed? Is it in a separate document?
No, there's a reference to that in housing. Piece on it, I think it's on page 7.
That was that housing one.
But homelessness,
Yeah.
I didn't put that in
717, I think.
part, we're kind of held captive by commerce on the housing piece. And the yearly updates, the commerce funding that comes to us that we have to return contract out to community providers. So we're addressing housing is important, but the other piece of it that really deals with that is our it's the grant we have through the CHG grant through commerce is what directs us on those activities.
Well, I will read through this. So, yeah, with the homelessness, I think that's a topic that needs to be addressed. And I've got to, what was it?
There's this housing one.
Well, the other mental health and chemical dependency, starting on page 12, the substance use. How,
I could make that easy for you.
well,
We could change it to say, yeah, how's worded right now. It's just a straight statement. When we say reduce the use of tobacco, alcohol, and say marijuana and liquor stores.
I'm sorry.
You say, so you can do this one. Or says, I think it just says something about smoking or tobacco. You can say reduce use of tobacco, alcohol, marijuana, and illicit drugs as that goal. And it kind of rolls those four things into what I think what you're thinking of.
I'm just sensitive to the fact that the first series of those are all legal to use. Obviously, illegal drugs, not legal use.
Right.
And again, I consider that a personal choice.
By the same token, food is misused.
Right.
And has health consequences. So
Well,
it aligns with that.
Yeah. Okay.
Yeah, but as soon as you start reducing those sort of things, somebody's gonna get upset about the reduction in revenue.
The flip side, as soon as you throw a metric out there, as soon as you say, okay, we reduced from a use factor of 50 for some random number, okay, and we go now to 45. The immediate next question is, wouldn't 40 be better? And ultimately, then you're tracking to zero, and it's like, wait a minute, this is a personal choice.
It's unobtainium, okay?
But to your point, that's why I've always pushed back on DOH attaching syntaxes to things because it worked. They don't have the revenue. The revenue would go to zero. And then you're hearing about that. And really they don't work and for a variety of behavioral issues. People will pay devices first. And that's
Oh, yeah.
how it goes.
Hey, David, it's not that I'm throwing rocks at you, but
No, I get it. I've been
You're the
long
one
on this
target.
your days and all that.
Yeah.
Okay.
So what does staff want us to do with this? This one?
I think this is for our review and comment. What I would, I guess, I think what I'm hearing is not opposition to having it in the comp plan. I don't think I'm hearing opposition, so that's good. Okay, I think probably the next, I'm gonna throw an idea on the table, tell me what you think. Next reasonable approach might be one, let's see if we can get this electronically. Maybe it's already in our email. Give us an opportunity to read through it outside of in a public meeting, okay, and be thoughtful. At the same time, the public has it, okay. So at a public hearing, they can then comment on what their 2 cents are on this, and very importantly, then we can get their perspectives before we make any decisions or any real direction. If that sounds reasonable, I would say we go down that path.
Yeah, I'm good with it.
I'm good with it.
All right. With that, I think we go on to the slightly larger piece.
Slightly.
I'll make a quick comment.
You can make it.
Thank you. I'm totally on board with your opinion on individual responsibility and all that. And I agree. Except in the case where the result of the bad decision, I somehow have to help fund fixing. That I object to. You know, it's like, the private insurance market, you apply for life or health or whatever, that's all these questions. Do you smoke? And depending on the answer to the question, you have to pay more. Okay, fine. But in the, in the public arena, someone who's, anyway, that's my opinion. That's my quick comment.
Well, and very delicately, that's, I think, the larger, harder topic is that, if I smoke, I drink, and now become a burden to society, and, you have to take care of me. Is that my fault or my right? Was that a condition or a situation that was put into? What does society owe me? What do I owe society? And I'm trying to be very, very neutral in what I'm saying and not take an opinion. But I think that's the tough, hard spot, because I think, in many of the topics we've tossed tonight, one could say, well, maybe you stuck yourself there, or you stuck yourself over here, or wherever. And what is our responsibility? And I think we need to, as a panel, at some point, that question needs to be addressed as a society.
Which is well outside our scope.
I like what you gotta say. Okay,
I just thought that needed to be said.
Yeah.
I know it's outside what we're doing, but
yeah. You wanna press right on? You wanna take 5 minutes? All good? All right, we're moving forward. With that, I believe we then go to staff report on the draft Mason County comprehensive plan, minus transportation.
So we have SCJ, we have first parent from SCJ to do the first presentation on the requirements. Before she begins, I just want to note that we all received comments from the PUD 1 and 3. You should have all seen that in the email that I sent. And most of them were just revisions, there's a correct number here or there, or some
Or administrative, like,
administrative, but there was one 0.3 under the bullet point 3 under PUD 3 comment. They had some language, I think, that was in a previous version that they suggested, and I think there was a suggestion by a PAC member to remove it. So I want to make you aware that, to look at it again and consider if you still want to keep it removed, or you want to add that language for a different version,
okay,
something similar. So,
thank you.
but you can discuss that after she does her comment. Over to you.
Well, great, well, thank you. As Marissa noted, Kirsten Peterson with SEJ Alliance, and online we also have Sharifa. And she had presented in the past on the climate, so in your packet, you did get a summary report. But we're also going to do, we have a quick PowerPoint, we kind of want to just go through it quickly for anyone in the public online or in the audience that's not really aware of it. Kind of go through a high level summary of the comp plan, what we've done today, the requirements, and then, we'll go down your agenda, got question items, discussion item, we got stuff. I am on the Zoom thing, so I'm gonna go ahead. And share my screen. Started. And this is something that we can also make available to staff. Very good one. Basically, as I said, we just want to kind of go through a real quick summary of what we've got in here. And we will go through, and hopefully you like the pictures we found online too.
Jump up to the right time.
And just so you know, we're also going to be going out and
Thank you
take
to mental health.
some new pictures so that we
Yeah,
can.
but then ran away.
We're gonna take some new pictures for the plan specifically created by SCJ so that we're not taking photographs without their permission. But basically, you guys have been on this for a really long time. The goal is to make sure you're meeting the GMA requirements as outlined in the RCW. So we're gonna go through what those state requirements are, summarize the updates made so far, and just highlight what the next steps are in this process. So GMA requirements, we've discussed them quite a bit. This keeps coming up that jurisdictions must update their comp plans every 10 years. It's a change, it used to be every 8 years, and then there's also gonna be a requirement that you look at this in 5 years, just kind of look at the implementation so far. So the updates must address changes in state law, which I'll go through a little bit, growth in the population and land use, new housing, environmental and engagement requirements, and also consistency with the CPPs, which this group reviewed several months ago and was approved by the Board of County Commissioners. So the purpose is to make sure the plan is actually relevant, it's consistent throughout, and responsive to current forecasts and priorities. Now, we did get your comments today, so we haven't had a chance to really go through that. We've looked through them. I will point out that that consistency thing is very important, and I think it was Kel that pointed out, we want to hear your feedback. But we also haven't gone through with a fine tooth comb. We have a marketing department that will help us when we craft the final plan, make sure all the figures and the numbers are all aligned correctly. But we've already found from Public Works that they might be adding a couple new tables because they've been reviewing that a little bit frequently. So we appreciate their feedback. We just keep getting a few edits that need to come forward. So the new state mandates. Oh, yes. And they are what they are. And Kel pointed out that we can debate ad nauseum about what we think about them. But just to point out the facts of it, House Bill 1220.
Sorry.
For accommodate housing for all income levels, including emergency housing and shelters. So we've addressed that in the plan. House Bill 1241 is the legislation that updated the cycle to 10 years instead of 8 years, and then that 5-year implementation report. House Bill 1717 is strengthening tribal consultation during the planning process. There are several others, including 5818, that are supposed to reduce barriers to housing production through zoning flexibility. So your comp plan is going to set the guidance documents, but then it feeds into your land development code regulations. Those are the specific requirements. So this is a supporting document, the regulatory framework. And then finally, House Bill 1181, what Sharifa will get into is more about the local government requirement to plan for climate change impacts as part of the comp planning process. So a little bit more about the requirements and the priorities that we're looking at. So we're looking at accommodating projected growth through infill and mixed use redevelopment, but maintaining community character while increasing the housing supply and affordability. So we're addressing the requirements. And then we also need to update the infrastructure planning and the capital facilities and utilities element. And so that's where Kel talked about the 6-year CIP and TIP. Those are required to be updated every year. So those will be adopted separately, and we're going to be referring to them in the comp plan. So we're not always going to just put them directly into the comp plan. They can be appendices if you choose, and the appendices can be updated annually. You can do that through an adoption process or whatever means you set forth there. And so just looking at some of the numbers in there, looking at the population increase, we're looking at a growth of 14,801. And that over the next 20 years, that equates to 7,037 units. But then you also have to accommodate for specific emergency shelters of 142, taking us to 7179 over the next 20 years. We need to look at the urban growth areas. So those are Shelton, Allen, and Belfair, and make sure that you can meet the capacity needs there. So we address that in several different elements of the comp plan. And then kind of looking at it by sub area, it shows the breakdown, like the percentage, like 41% of that projected housing increase would go into Shelton and its UGA, 33% into Allen and Belfair, and 26% in the other portions of the county. So with, oops, sorry about that. Got my little Zoom bar that keeps getting slow, put out of the way. So with the comp plan, and this kind of came up through the discussion about whether to include the health and human services element in the plan. The mandatory elements are described in the RCW. You must include land use, housing with income-based allocations, which is getting really tricky these days, capital facilities, utilities, transportation, And actually, we're seeing this is not required in here, sorry. You need to update the slide. Economic development and parks and recreation are not mandated, but they're optional and they're included. And then we have new chapter 10, climate resilience, which is being required to address state requirements. So we will fix that before we send it to you guys. Okay. So for today's session, we will look at the 10 different chapters: the introduction, the community profile, land use, housing, economic development. We're bypassing transportation today, rural and natural environment, the pros plan, capital facilities, financing utilities, and climate resilience.
If I can, when will transportation be available?
It's pretty much ready. Today we're going through it, just adding a couple of edits that Loretta made to the transportation chapter of the EIS. So I probably will have it over to staff tomorrow for them to review it.
TIPCAT meets on 10 September and our packet typically will come out the Friday before, say the 4th. It would be really helpful if TIPCAT could review it in early September to at least give this board then an opportunity with TIPCAT's input. That would be really helpful.
That was something we discussed last week, was what the plans were, for what to do with that. So we'll get it to Loretta and she can.
Yep,
do what she
you
needs
get
to
it
do.
to Loretta. Like I said, we talked earlier today and I asked her that same question. She said she was gonna call you.
It was probably her who left a message that I sent
Yeah.
today. And so I'm gonna send that to you. We were also converting it to our new format, like that's not as important. What you want to see is just the text. I understand that too. So with this just shows the comparison. If you can see the slide of what's different, we changed chapter 1 citizens guide to just say introduction. Chapter 2 used to be the countywide planning policies. We removed that as a standalone document, so that's already been adopted separately. So the new chapter 2 is the community profile. Chapter 3 stays the same, land use. 4 was rural, but we've moved that to 7 and it's now rural and natural environment. Economic development has been moved up. Chapter 6 is now the transportation element. And then we talked about 7, and then 8 really is, we brought you previously like a summary of the pros plan. We ended up at your direction changing it to just a 1-pager that we just discussed. It's just adopting it by reference. So if in the future, say in like 3 years, you guys adopt a new pros plan, you're just adopting it by reference to the comp plan and it's still referenced in there. And then 9 is the capital facilities, financing, and utilities, which is a combination of what used to be chapter 6 and 7. And so that's been a lot of work to bring that together, and Loretta and her team have been doing a lot of great work getting us that information that they needed. And then chapter 10 is climate resilience. And I guess we need to get a final determination on what you're doing with that human health services plan, and if it needs to be adopted by reference or.
Yeah, I'm leaning towards adopting it by reference, just like the pros plan, so that, in the health, they can update it as necessary and outside of the 10-year cycle. And then this can just always reference the most updated version of the health benefit.
It's an easy way a lot of jurisdictions do. I know it's a little bit outside, it's a lot outside what is accustomed here in the, but there's a little time to make that decision. I think you guys are gonna review it.
Just real quick around the table. Does anyone have a preference? Adopt by reference or physically having it? Or do you think about it? That's a fair answer too.
I mean, that's the only I think.
No one's.
Think about it.
Yeah, okay, great. Keep going.
And then the other thing is there used to be a chapter 12 implementation, but looking through that, it's really been embedded throughout all of the plans. And so that's actually something that in 5 years, the staff will be presenting, like, this is how we've been implementing it through other regulatory documents, and some of the goals and policies at the various chapters refer to how to implement these items. Because as you were talking about the human and health services element, some of them are ambitional, they're aspirational ambition type ones. And that's kind of what the comp plan is, they're visionary. So then you have these other documents that you adopt that where you take action. So your land development code. And then there's other codes that are put into effect, like Public Works usually has a standards document, like these are the exact specifications you follow for, meeting these other requirements that are referenced at a high level in this plan. So this is your goal setting document. So this is where in your summary report you got in the packet, this just kind of gives a little bit, like even a little bit less than you get in the packet, but chapter 1, the introduction. It's just laying the legal and policy groundwork for the comp plan. So it defines the purpose of the plan that we just kind of covered. What the role is with complying with the Growth Management Act, the framework for it, like the goals, linking it to other regulations and plans. So several other county plans that we just referenced are included in there. It talks about how the plan is organized. There's a small section on the public engagement piece, although there is a completely separate document that if staff wanted, they could keep it on the website to a company that just describes the public outreach that occurred. But there's a small piece in this chapter 1 introduction. And then the implementation is where it ties the policies to zoning and the daily decisions that your planners have to make and folks in the other departments. So the community profile is a document that you guys reviewed months and months ago, but it gives you a lot of information about your geography, land use, climate, natural resources, and it just summarizes all of the different conditions in the community. And it's supplemented by the actual housing needs assessment that was conducted by FCS Group separately. And it also gives the growth forecasts that were shown previously on the slides. And then it also talks about the sources where this data came from. And I know there's been a lot of conversation in the past that we want more current data, but sometimes the most current data is not keeping up with where we are today. And so we go with what we have, and sometimes we're not able to drill down to the details that you sometimes want, like exact specifics of the community. Sometimes we'll do another study, asking somebody to do those kinds of deep dive studies. With land use, obviously this one is a very important one where all of them are shifting the planning period from 2025 to 2045 and updating the forecasts. So how are you going to accommodate the new population with your land capacity? And do there need to be any zoning updates? And one of the notable changes was removing 6,000 plus acres of residential capacity from Green Diamond. And then the equity focus that comes from the required House bill legislation, integrating environmental justice into land use policies. And then chapter 4, there's some similar changes made there where we've taken the data from the housing needs assessment and incorporated it into here, and it will be adopted as an appendix to the comp plan. But this is where we're really going to be addressing the House Bill 1220 requirements, the income-based projections and rent gap analysis. Fortunately, in your county, you've got space to really delve into this. Some of the smaller jurisdictions, the cities that are compressed by their land area are having quite the challenge saying, because you actually have to say, well, we're gonna accommodate the folks in the 0 to 30% range here, and the zoning will accommodate for that. So there's actually some interesting conversations going at the state level with that right now.
Very nice, very softly said. It is what it is.
There's a lot of conversations, yes.
Yeah,
We'll see
very
where it goes. Right now, we're focusing on just meeting the state mandates, and in the future, if the state should change them, you'll talk about it then. But I don't think they're gonna make any state changes by the time this is due for adoption. We also need to address displacement risk and the racially disparate outcomes, so that is accommodated for. There's a little bit in the HNA, and then we've also talked about it in the actual housing element itself. There's some community input that revises policy on housing mix, telework and seasonal units. And then we do refine some of the language within there. There was a lot of conversation, as you guys well know previously, especially when we were talking about the countywide planning policies and what was appropriate for the CPPs versus inclusion in here. And I know many conversations have occurred with what was going to be included in this element. Chapter 5, economic development, introduces the 4 integrated objectives. There was a lot of feedback from this group on it, some requests to refine the data. We in some places we could refine it to their level requested, and others we couldn't. We did have the EDC look at this, but the objectives are retaining and growing local, attracting new, cultivating talent, and strengthening the base. And then just kind of focusing on the current trends that they're seeing. So really that healthcare, which you actually heard about just a little bit now, and social assistance leading growth. And then linking the economic strategies to public health and livability. And I think it's great that that element is being updated right now simultaneously, and it supports what you need to grow your community and providing the things that they need for folks to want to stay here. Some other key strategies are emphasizing broadband, the workforce, water quality, and resilience, and then discussing partnerships. So really, what are the roles for the ports, the tribes, the city of Shelton, schools, and utilities? And I know that we had a lot of great feedback also from like the library system, you know, what they do to provide resources to folks. And so there's just a lot of transportation. We just discussed that a little bit. The existing conditions analysis is incomplete. Future conditions analysis is pretty much finalized. When we send it to Loretta tomorrow, it's going to have like 2 little areas just flagged in yellow saying, as soon as we get the Shelton transportation demand model, we will update these tiny little pieces, but everything else is done. So we'll discuss that in more depth next time. The rural and natural environment. This is one where we kind of combined information to make it where it took information out of the previous land use element, combined it with the rural element. So this will just basically meet the GMA requirements, add some statutory definitions. It's got the landmark designations in there, some guidance on density. It standardizes rural zoning descriptions with updated acreage data. It links to the county resource ordinance and preservation policies, and it highlights tribal treaty rights and stewardship of natural systems. So this is one where a lot of information was provided by staff, and I know that a lot of information was provided by Marissa on the WIRA updates and just kind of making sure we had everything looked at. And I believe there was feedback from which tribe was this?
That was no land use.
In the land use element, okay. All right, thank you. That's where we had some merging of things where I'm getting them mixed up, so. Chapter 8, Parks and Recreation. This is what we talked about before. Basically, what you see over here on the right-hand side is what shows up right now. It's just one pager referring to adopting that 2022 pros plan by reference. So as it's adopted, as we discussed, it's a standalone document, but you're adopting it in a comp plan, so you could technically refer to it in one application. They have their own allowances anyway with the pros plan because the state has guidance on that. And then capital facilities, financing utilities, the huge chapter. Like I said, we combined the capital facilities and utilities. This is one that took up just basically a lot of feedback from Loretta and her team and continually looking up data and sending us the information. We didn't necessarily like write it. We compiled information and reorganized it into a logical sense. But basically what you need to do is list all of your providers, public and private. You consider your growth targets that we have to look at, and then make sure that we're planning for facilities that need to be expanded or brand new ones that need to be built, whether it's your utilities underground, overhead, or your buildings where you're providing services and looking at the levels of service. So there's a lot in there. And there's some new utility policies added for coordination with the private special districts. So it's been really great, like especially I think PUD3 I think was on the call today, and they've been really great about providing feedback. Sometimes it's a little more challenging to get information from like say the school district. So we usually rely on staff to help with like if they have a local connection and know who to call. I will like to say that sometimes, say like, and I'm just using the school districts as an example, sometimes folks might get an email from somebody they don't know and they are hesitant to respond, which I fully appreciate because we have to take IT trainings all the time. Like, don't click on a link if you don't know who this person is. So we've appreciated Marissa's help in gathering a lot of that information that we needed. So we also needed them to adopt or put together their new capital facilities plan. And that was within the last month, I want to say, but we got that finalized from them. And then just the adoptions of the 6-year CIPs and TIPs are integral to that. And the TIP goes to transportation, but this is a document that we spent a lot of time working on with Loretta, but we even got a few more edits recently, so we will continue making sure, refining it and making sure it meets all of her needs and has all the right numbers and projections in there. And then really, you're also supposed to plan for the financing. So that's where, while you were talking about making sure you can have funding sources available, that's where you reference what they are. And it's very important for this, but this is also another one where if it's in your comp plan, you're more eligible, or sometimes it's a requirement to be eligible for certain grants. So, rotation improvement board, so if it's in your comp plan, that's great. And then you've got your 6-year plan, and maybe because of a new development going in, it became more necessary to do a new road construction in a sooner year than we planned, but updating annually, you can change your CI. So, and then climate resilience, where Sharifa can jump in and speak to that one a little bit more. And I think, yeah, it's only one slide to that because she spent months and months working on it.
Yeah, thanks, Kirsten, and hi everyone. It's nice to see you all again. So for the climate resilience element, what we did is that we incorporated now as a chapter of the comprehensive plan. We did need the standalone document to submit to Commerce because it has its own grant. But then we modified that document to fit as a chapter. We removed a lot of the information that is redundant with the existing introduction in the larger comprehensive plan document. And what this chapter does is that it summarizes the state requirements related to the climate resilience planning. It goes into the relevant priority hazards in Mason County and then views them from the lens of the local assets in the county that we identify based on the 11 sectors that Commerce identifies in their requirements. Then we go through reviewing those hazards, looking at the risk and vulnerability. I noticed some feedback about that rating. I just want to say that while we didn't spend so much time looking at the comments just yet, we did look and utilize the rating that is used in the existing 2023 hazard mitigation plan. And we tried our best to have the rating used in this climate chapter to match what was done in the hazard mitigation plan. And then general lenses to look at the goals and policies development. Two things that Commerce pushes and requires is having an equity lens, so ensuring that our policies that we're pushing forward do address populations that are more impacted or more vulnerable to certain hazards. So we try to address those and capture that in our goals and policies. And then similarly include some goals and policies that highlight the partnerships that are needed with the different jurisdictions, different communities, different tribes and agencies that are all impacted by the different hazards relevant to Mason County. All right, Kirsten, back to you.
Great, Beth. Okay, so we have a really basic one slide for the next steps, but it says a lot on this page. Basically, we're in a PAC meeting today. The plan is to have the draft element and full plan back to you guys, and we're letting staff kind of lead the plan for the public hearings. I believe they wanted to do in September. We will refine on an ongoing basis as we receive feedback, but there is a point where we kind of have to draw a line and say, okay, we this thing, and you can always wordsmith things as long as we're meeting the requirements, but there needs to be the we stop that. And then the EIS, the plan is to get that out for notice on September 8th. And then also need to put the Commerce review out. And I saw a comment from you, Will, about how that works. Basically, you had asked something about whether or not Commerce was essentially like pre-approving it.
Yeah,
And
so there's comments in the plan talking about housing element and that when we send it to Commerce, and I don't know, probably maybe further in the review process, basically, they'll send comments back. And then we need to resolve those comments to where they're comfortable with the resolution.
Yes, so you have a 60-day review.
If we send if we resolve it, our comfort level, but they say no, then what?
Then we probably sit down with them, well, not in person, but probably virtual meetings with them to discuss it and figure out what they would require absolutely as the minimums.
So they have a pre-approval.
Essentially, yes. So,
It's very important.
yeah, so what we wanna do,
Congress now pre-approves the housing element, in essence.
well, the entire comp plan. They actually review the entire thing and they'll give us feedback on any of the mandatory elements. And they have a checklist, which I have with me. Not that I was gonna pass it out, but it's something that it's something.
Don't.
It's something we submit, it's created by Commerce and it goes through every chapter and it says, hey, per the RCW, you need to address this thing, and it gives you the exact element. You click on the electronic version, it takes you there, and then you say where you address it in your comp plan, like which chapter and which policy number. So that they go through this to guide them, and if they don't agree with you saying yes, it meets it, they will make their own notes and they'll get back to you. And so they give you feedback, and so the goal is to get it to where when they see it, there's not too many changes that need to be made. And they want to approve it before it's adopted by the Board of County Commissioners. So do you want to speak to that either of you?
Yeah, I mean, I'll just say that, it's the advisory committee, it's not really of your, because you'll be making a recommendation to the board during the time that they're reviewing the 60-day comment. So it's really prior to it going to the board that we have all the recommendations. And unlike the Department of Ecology, who literally approves our shoreline master program, Department of Commerce does not do that. They will review and they will give us guidance to help ourselves against appeals or what have you, but they do not technically approve our plan.
Yeah, the word pre-approves.
Yeah, it's
Yeah,
not,
well, that's not.
because Department of Ecology, and this is semantics matter. Department of Ecology under a shoreline master program, Department of Ecology will approve your plan. You get to update it, and then they will approve it, and then there's a lot of back and forth if that doesn't happen. Commerce will just give you guidance and and then say, good luck and go forth and prosper, but
It's a consistency tool.
yeah, it is a tool and they're there to assist us, but they are not technically adopting or approving our plan. And I want to hear your concerns about this, Will, because I can see you're very concerned, but I can't understand why.
When I read it as if we don't address their comments, and this is you're framing their comments are in regard to, have we met the law? Have we met the RCW, the law? And I just, when we started this 18 months ago, it was the authority rests within the three commissioners that sit on the board. And when I read that, I read it as, but it can't get to the board unless Commerce says okay, which
Okay,
is
so
in essence a pre-approval.
you're going down, I think, way too. The only authority we have is through the state. So when the state passes laws and then passes them down to us, we have minimum standards under Growth Management Act, under these certain elements that it has to meet. It's a lot less than what we have in here, but I mean, we're trying to meet the minimums. And so when Commerce goes through that checklist and they'll say, you're not meeting this, it's literally guidance, because unlike Ecology, that won't even allow us to approve it without their approval. Our Board of County Commissioners who sit here, they can say, okay, thanks Commerce, but we disagree with that. And we don't think there's going to be an issue, whatever that may be. And they take the risk and they adopt it anyway. And then if we are appealed by any number of people or groups or entities, it depends on, it ends up going to a growth management hearings board, and then from there it could go on. But did a staff person at Department of Commerce make a recommendation to the board that the board didn't agree with, and then we get appealed on that specific thing, and then a growth management hearing board says, you know what, the county and that's correct, or the other way around. But Commerce is not approving our plan. They are giving technical guidance, and so if you saw the word approve, that's not the technical
I
term
have to
for
go
that.
dig into the
Yeah,
document.
no, I
see
saw
what the
it
word
somewhere
is. Yeah.
too, so I know you read it correctly, but I guess I just, it's important, if you're that concerned, then it's important for me to clarify to you, to make sure you know Commerce is not approving our plan
Okay.
in the way that Ecology approves our shoreline master program.
So it's on the first page of your comments, what you were referring to, where you said the draft currently reads, once any suggested changes are made and the update is accepted by Commerce, the plan can be formally adopted by the Board of County Commissioners. So if we want to revise that language slightly.
Accepted by Commerce means they approved it,
Yeah, but it's
but if they cannot do that, then the language in the text needs to be revised.
where's the text?
I believe it's page 7, according to Will's, track sheet.
Page
Yeah.
7 of the.
Page 7 of the comp plan, and that's not page 7 of the document, it's the number on the page, because it got too hard going any other direction.
Okay, so
Let me try and open the see it. No, I did.
Okay, 1.3.
78.
we can revise it. So this is what it says. The Washington State Department of Commerce reviews all locally adopted comp plans to ensure compliance with the GMA. During the 60-day review period, Commerce provides feedback and suggests changes if necessary. Once any suggested changes are made and the update is accepted by Commerce, the plan can be formally adopted by the Board of County Commissioners. So we can certainly update that.
So you need another word besides accepted then.
I think we can revise the whole paragraph a little bit.
Okay.
Anyway, though, like we kind of got off track on my own accord. There will be that 60-day comment review, there will be the EIS notice, and then there will be hearings with the Board of County Commissioners, so. One or more, however many decide, and then I believe, yeah, that was inclusion of the PowerPoint. But that was such a general summary of this massive document that you've been reviewing chapter by chapter. And so I know that you guys wanted to discuss it in whatever fashion you had planned for tonight.
All right.
Questions?
I have a plan. We'll see what everyone thinks. So, we have a question and answer period. And then we have our deliberations. We have 10 chapters in front of us. And so as a starting point, so I would suggest for tonight that admin errors we sort of don't get too focused on right now. We focus more on the overall intent. Do we believe that are there gaps? Are there changes? Are there things we don't like that we want to take a different direction? I don't know if you want to go chapter by chapter, and then if we go chapter by chapter, do we want to have question and answer and then pause the discussion period to the very end? Or do we want to try and intermix that? And I'm sure I'm stepping on some rule that Mariah will keep me correct if I misstep, because we technically question and answer is separate from discussion. But I'm trying to put some organization to this, because what I would like us not to do is for me to discuss chapter 2, and you just jump to 5 and you pick 7 and off we go. I think maybe we can put a little more structure to it. No one shaking their head back and forth. That's good.
Structure, I think it's a good way to go.
Okay.
Again, we're.
Lead on, Bear.
So with that, comments or thoughts, or are there any questions with regards to the introduction?
No, the introduction, no. And one point. You have the document and then you have this party that has a PUD3 that has a request for a change. How do you see that? Waiting till we get to that point?
What chapter? I'll be honest, I haven't.
Okay,
Capital.
capital. facility.
Great, it's down the road.
Okay, fine.
It's whenever we get to that chapter. I have, in fairness, I haven't read, it's like
That's fine.
the attachment on the full analysis that the CPAT team did. I have not looked at that. I just haven't got there. It was just too much to read. Okay, so what I'm hearing then is no questions, any, okay, so I will move on to community profile. Questions for staff?
It might take a second because I haven't correlated this out, the question versus, errors versus whatever, so hold on a second.
Yeah, the admin things, I think, I think the SCJ team and staff can handle it. I don't think they need us to necessarily discuss it.
Not discuss it, no, I think we should list it, but.
Yeah, but you send your comments
Yeah,
in, they got the list.
Okay, so. Okay,
In the interest of time, I made several comments in the document. But we don't necessarily have to go through them now. Come, you guys can look at it and
Well,
answer my questions, or is that the wrong way to do it?
Are you asking the staff about it or these guys?
let's ask staff about that one.
On range, I glanced through them like, I don't
So
know.
some of those would have to be SCJ answering. So. Which I provided, and they probably haven't even gotten it.
I'm sorry,
If I provided your questions to SCJ too, because some of those documents where you were questioning community profile, those are documents that came from them. So I don't know that they've had a chance to review all of that yet.
so you look at them and
Or-
get back for the answers.
Yeah.
questions first, corrections second, so to speak.
Yeah, you can intermix them as far as I mean, the real question is, do you have angst or pushback on community profile? Does something need to change, or are you generally comfortable with it? I mean, like I have,
Okay.
yeah, I mean, I
That's
have
why
an admin comment, but they can handle it. They don't need me to discuss it.
The community profile, though, you guys did adopt
No, I know,
It's not
Oh, no,
adopted, but it's
one that you went through.
no, I know,
Oh, yeah, okay.
and so I'll be short.
You
So-
sure about that?
Well, Ben, so quick question on. I raised the issue about the discrepancy between census and the school counts. Did you ever get any further with that?
And the school counts is what you said?
Yeah,
I will have to look into that one. It's been so many months.
it's about 2,000 students difference.
Okay,
Okay,
but what page are you on? So I can find the right location.
page 16 of chapter 2.
These are page numbers off the document.
Yeah.
I is its own page.
I believe I have the correct version.
Yes, that's the one.
Because I thought it would be easier to write on it versus
Yeah, it's,
typing in.
And this is kind of an admin, but they need the education to do it. You remember you had the 3 references, anyway, you have a figure dash 6, it's 3 times in the report and it's in 2 different formats.
Okay.
And what I mean by formats is, the committee, the advisory board here discussed the fact of how to scale it. 2 of them are correct and one's not. The one that's not is 2-6.
like, I would just put the figure in once.
Either, I don't care, either way.
Yeah, and I'd seen that comment too, and I
Yeah.
think that we were just basically updating the existing plan, but we don't need things repeated several times, so.
It's voluminous enough.
Page 21, chapter 2. There, in my opinion, there's a major financial economic thing to this county that you seem to kind of overlook, and that's retirees. And social security and retirement benefits and all that kind of, and if you look at what actually comes in and month out, you look at some of the other areas, it's a pretty big piece that drives this county. Just observation.
Yeah, there's a lot of wealth coming into the county that was generated elsewhere. If they sell their house in California, or they bring their 401ks with them.
And they buy the place cash.
Yeah,
And I am through chapter 2.
Okay.
Questions? Or corrections?
Do you have any questions or comments on chapter 2? There in.
Well, I think I'm done. Let's see, I'm just double checking
Okay.
my notes.
Okay.
Um. Yeah, chapter 2.6, I'll jump a little bit here, but let's stay in chapter 2.6, page 23. There is really not an employment base in Allen. You see, your statement says there's a strong employment base in Allen, Belfair, Shelton. Is there 3 regions? But there is not, I mean. If you're
Not this.
Don't go there. 2.5.
Yeah.
On 2.4.2, page 2021, we really never addressed the institutional population and its impact or anything.
Sorry, can you tell me a page again? I'm still taking notes.
Sorry, it's page 2021. Which is what 20 and it rolls over to 21,
Okay.
which is chapter 2.4.2. We have a graph in there showing the institutional population, but nowhere in the plan do we talk about that factor anywhere. And I don't know if that's, it's never covered this, 1,100, 1,200 individuals, but. Just a sec.
And you just want the referenced and acknowledged, or when you say we don't address it, what do you specifically for?
My recollection is that it's just like, it's like this entity, where we don't talk about the economic impact or anything of it, or, any of that kind of factor. And maybe we're just not prepared to deal with it, fine, note it as such and move on to the. But I mean, in other words, it's what, 75,000, 80,000 or whatever per inmate. That's a lot of funds coming in and working its way through that outfit.
Through the correctional facility.
Right.
And there's a lot of people who work out there.
Right. Like 600 or 700.
While we're on 20, with that, we're here.
Go ahead.
So on 20 and 21, there's a 2.4.2. There's a paragraph that starts with racial and ethnic diversity is also growing, particularly in urban areas. This increasing diversity underscores the importance of ensuring equitable access to housing, education, employment, and community services. So what is inequitable today?
So that's a conversation you were starting with, previous conversation too. It's just, that's in there to help address the 1220 requirements and other requirements, and I think we could spend all day talking about what equity means, so.
The way I read this is that we are treating some of our population differently than others, and if you will, with harder access to housing or education or employment or community services solely based on the race or ethnic background. I question that, strongly question that.
And just for all, regardless, you know.
I agree.
Fans, everyone.
I agree. But we are in a nation right now where I am the enemy. White, I'm male, I'm married. I'm the enemy. That's just the way it is.
Don't forget about evil settlement.
Yeah, well, absolutely. And I'm pushing back saying,
Okay, Will,
no,
so, we keep this in the planning department to remind ourselves that we are no longer, planning departments historically were generally white males, but regardless, it was just the large majority makeup of the United States. But here's an old plat, just one example. We don't do this anymore, but the Growth Management Act wants to ensure that we don't. So here's the restrictions on this Mating Sunny Shore Edition #2. It's in Mason Lake. No person other than one of the white race shall be permitted to occupy any portion of any lot in this plat or any building at any time thereon, except as a domestic servant actually employed by a white occupant of such building. And so
when was that written?
this was in 1951. We have others from the 60s as the latest, the most recent. And we don't do this anymore in Mason County. But there are some jurisdictions, think about, I mean, I haven't come across, we're so small in our development regulatory world really just got started in the 90s under Growth Management Act. We had building codes, but we didn't have a whole lot of other codes other than in our subdivisions. But I imagine there's still jurisdictions across the state that have these old school language allowed on their books. So we're just like, get rid of all that. Everybody's equal.
Well,
So that's what, when people come into the front door over at the community center or at the permit assistance center, we try to treat everyone equally. That's it. That's all.
do we have white, so that addresses housing, do we have like issues with education? What about employment? What about community services?
Perhaps you can poll your PAC members to see if people, if you have a majority that wants to come up with different language that you would
Well,
recommend in the.
I'm trying to avoid writing this, and I'm shocked we still have language like that out there. And at some point, one of the requirements was to review our ordinances, and I'm hoping we have, but we'll get to that in housing. Have we reviewed all ordinances to ensure at the ordinance level that none of that type of language exists?
Marissa, a couple of years ago, went through a complete Title 17 development regulation ordinance overhaul. We didn't find any language like this, so I feel like we are ahead of the game. And we aren't doing another ordinance overhaul till this is adopted. Then we'll look at the goals and policies set forth in each one of these elements, and then look at our regulations to determine if they're up to date on the goals and policies adopted in this comp plan.
I mean, in theory, the racial cohorts should be irrelevant. Everyone should be treated the same. Like apparently you're trying to do.
You're a human being.
Exactly,
Period.
but my point is this, and I wonder about this just in general. When you make these rules, it really, if you're trying to accommodate particular cohorts, it should be by economic category, not racial, in my opinion. If you're in an economic, you not as well off, yeah, maybe you help them out somehow. But my uncle Bronson Lewis, very well off, but he's with George Woodhouse. Anyway, my cousin Stevie married a black guy. had 2 black kids. Went to Wazoo. Didn't need any help, you know, the family's very wealthy, but he got all this help because he was black. And I'm like, well, good for him, but those kinds of things, in my opinion, should be based on economic status, not strictly racially divided. That's my opinion.
Thing is, they're following the law.
Is there data that we have that shows that this is a problem in Madison County currently? Has there been, is there surveys? Has there been any public testimony of people experiencing these kinds of problems where their racial or ethnic background has gotten in the way of housing and education and employment?
The Mason County Climate Justice Affordable Housing Survey, I believe, implies that. Well, I believe it implies that, and see Julianne's there, if you can, you know, please feel
I think
free.
we're digging a little bit
Yeah.
deeper.
Well, I mean, the question is I believe we have information that says that the Hispanic community and the Black community, there's more of those families living in low-income housing with lower AMIs, you know, so you have that sort of a relation. But I like, and if I'm going to dig a little bit on what you're saying, Randy, is I think oftentimes we take that first brush and we say, oh, look, here is a group of folks, they happen to be of a certain racial or gender or whatever, and they, you know, make less, have lower educations. And the reason why is because of the race or the gender, where maybe there's a deeper question that needs to be asked. Are we really digging to the root cause?
So what did the report say? Did it were there instances of discrimination that could be pointed at?
I mean, Julianne, can you?
I'm so happy to share.
Well, the question is, can it be directly associated to discrimination? That's the question.
So you got to hear a direct story from Alan. The city of Shelton Council also got to hear a direct story from another one of our youth of racial discrimination in housing. We also have examples of historic votes. And I believe HB 1220 and the GMA requirements talks about historical context that sets things up right now as well. I'll find the exact language in a second for you. In addition, we have current data. Give me a second to pull this up. When we did our presentation on January 13th, give me one moment to find the right page.
January of this year?
January this year, yep.
Just before you were on there.
So we pulled the most recent data from the Department of Commerce, which is also the one that's going to be reviewing your guidelines. And there's a higher cost burdening for if you divide by race. I am sure that it is possible to ask the housing subcontractors to please take or to get the original data from Commerce and subdivide it again by income level as well, so you can break down and see the disparities or not by race and class. But this is old data, we showed newer data to you all, but the most recent data available by Commerce shows that approximately 27% of white folks are cost burdened in terms of housing, yet 44% of BIPOC families and households are cost burdened. Huge disparity. In addition, you can see homeownership rates by race and ethnicity in Mason County. 82% of white households in Mason County are homeowners, but only 53% of BIPOC. And when you compare overall in Mason County, we actually have higher rates of home ownership than across Washington State. So the
And that's because we have a lot of like mobile home parks and people who own RVs and that kind of thing. But there's a much greater percentage of white folks in Mason County that own homes way above state average, whereas BIPOC folks that own homes in Mason County, it's a little bit above state average versus a lot above state average. So we have a greater disparity here in Mason County than on average in home ownership across the state. In addition, in the survey, the affordable housing survey that we did, we asked folks, have you ever experienced any of these housing problems? And then our consultant kind of divided them by subcategory. And comparing BIPOC households with white households, it was about the same if you lived in dangerous or substandard housing, 59 and 60%, basically the same. It was about the same in terms of domestic history or trauma, 22 and 23%. It was about the same. Do you have environmental issues like flooding, 21% and 20%. The biggest disparity, however, was in problems securing housing. 67% of our BIPOC respondents reported problems securing housing, whereas only 49% of our white respondents said so.
Okay.
So there is a fair amount of data showing that there is discrepancies. How we solve that, there's a lot of options. In the January 13th presentation we noted that there's a much higher percentage of our BIPOC households that are low-income renters. So if you do policies that support low-income renters, which will get to your point about wanting to make sure we take care of those most in need, that will help all low-income renters, including white low-income renters, but will also have a disproportionate impact on the BIPOC households while lowering the disparity gap. And then the final thing that I think is pretty important is we ask people, what do you think about things? And so, for example, I think we can all agree, and so did 95% of people in our survey, everybody deserves a stable, safe place to live. And 92% said, yes, we need more affordable housing in Mason County. Where there was a lot of uncertainty was, is housing discrimination a problem in Mason County? Well, there was only 15% of people in Mason County who was like, it's definitely not a problem. There's no discrimination. We don't need to deal with that. Only 15%. About half the respondents, 46%, agreed or strongly agreed that housing discrimination is a problem in Mason. And more than a third, 39%, were neutral or unsure. But if you break those numbers down by white folks versus BIPOC folks, the numbers were, it was a huge difference. 45% of BIPOC residents strongly agreed that housing discrimination is a problem here in Mason County, whereas only 23% of white respondents. And a much bigger percentage of white people were really unsure whether or not it was a problem. And I think you can see that play out right here, where the young people of color who've come up to speak have said, yes, this is a problem. And then the white folks who may not experience it directly themselves might not see it. And that's totally normal and understandable. And it doesn't mean that any of us is better or worse or more or less deserving than anybody else. It means that there is a disparity issue. If you don't like the data, then there could be a policy about uncovering the data that you want to see so that we can meet the law and the requirements of HB 1220 and the mandatory elements of the RCWs governing the growth management act.
Thank you. With regards to what information we would like to see, and please, anyone correct me if you disagree, I'd like to simply see objective information. I don't want it tainted. I'm not looking for an answer. I'm just trying to get a perspective of what's really going on. I struggle with some of the things that have been said, only in that it sounds like we're trying to legislate people's actions, and I don't know how to do that. That's where I struggle.
Are you talking about in terms of turning this into a policy?
Well, no, I'm not. We'll get.
Because if this is talking about division,
No. When we get to housing, it's. Yeah, I have some. I'm struggling in that we have talked for 18 months about housing, and we are quite frankly where we started.
More frustrating.
Okay, we have found any idea on lowering the cost of a home has been pushed back very quickly. The only solution for housing is to tax people, to publicly fund it, to tax people to fund it.
We had like 50 different proposals that want all that.
What really works is driving the interest rate up.
Can I make a suggestion based on time here, because
Yeah.
we've done about
Thank you.
of your 60 minutes.
Yeah.
And you're only on chapter 2. So we have comments from Randy and Will that were presented to you to look through. So if any of you have comments on their comments, we can go for those. Otherwise, staff and SCJ also has that, and we'll be addressing them. So we're hoping to hear from everyone else on specific, really, what do you have a big issue with?
Let's,
But
if I-
I'm sorry, I need to interject. Will, your statement about exactly where we were, what do you mean? Do you mean in the
I mean.
world of housing and how it is right now?
We have
Or
no
are you
more
talking about-
solutions for housing to provide a home. We have a
Okay.
gap in housing than we did 18 months ago.
We haven't adopted the plan. So the plan, it's a 20-year. It's a visionary, like Kirsten said. It's a 20-year plan, and you should be focusing then on the goals and policies that might inch us forward to doing something. And I do recall making notes of several ideas that came up that I told Marissa, I'm like, hey, these are not bad ideas, that whether they go into a regulatory thing or whatever. So we're not solving anything overnight, and it doesn't matter about our opinions on whether or not it's going to work. We are trying our best. And so to make a comment that we're no better off than 18 months ago, I just want to know, are you talking about the state of the world affairs in housing,
No,
or this chapter that we're not getting anywhere in 18 months? Because I see a lot of work that's been done between 18 months of the housing element.
We have verified in housing, I believe, okay, that we have the land and the zoning to
Correct.
allow a breadth of opportunity.
Right.
Primarily our urban
That is
growth
correct.
areas, okay? We have talked about the infrastructure, but as far as trying to promote development of homes, we have struggled. The only real answer
It is not your job as a planning advisory commission member to worry about the development of homes. I want you to focus on the goals and policies that we are going to be presenting to our Board of County Commissioners for adoption, on whether or not they make sense for Mason County, and then whether or not Marissa and I follow through with looking at development regulations that would then implement, and Loretta's team and Dave's team, et cetera, all of the departments that are impacted by this comprehensive plan. And to get hung up, it's frustrating for me, as you can all tell, and it's not very professional of me, which I've never pretended to be. I do act as one, but it's not in my nature to necessarily be professional. But this has been a very frustrating process for a lot of different reasons. And one of them is that I feel like that you can spend a lot of time talking about things that we don't have control over. We don't have control over the state requirements of what we put in our plan that we want to get adopted, so that all departments other than DCD can continue to be in compliance with the state and receive state and federal funding. And this is not all that complicated. We are not going to save the world in this document. We can only react to development proposals and sort of guide it. The biggest thing of growth management that I actually like is that we have designated urban growth areas. Let's put high density in these certain areas where we have sewer, water. Unfortunately, in Mesa County, we don't have very good road networks, so that's a problem that I don't like to think about, but, so, you know, you put infrastructure in those places and then you keep the rural areas rural. And that makes the rural people like myself happy, and it makes the urban people like myself, who's urban and likes to visit urban amenities, happy. And so we're trying to do the best that we can do. And I know you are beyond, you have a brain power that's beyond the capacity level necessary for a planning advisory commission member.
I'll think of that one.
I would have thought.
No. I should
And
translate the
so-
whole sphere to go.
Yeah.
If
So
I
I
could
just-
say something really quick, I'm not personally convinced that it's to get there that it has to be publicly funded. Suppose people do have ideas. I have a few I've talked with commissioners about and stuff. Could we like send ideas to you?
Yeah,
I think you can do it this way, this way, this way. Okay. On the statistical analysis, which is really good, of the different racial cohorts. I think I'm pretending to be an expert, I think some of that is like, Mesa County's been historically very white. And huh?
Before that native,
Before what now?
before white native.
before white people, it was
Before
all native.
1840.
No, I get it,
Close.
I'm talking about
Come on.
recently.
Just say it, Randy, and let's move. I'm sorry, we're
We're digging in too deep.
Oh,
we
Where's this?
are way out.
Well, that's not my fault.
No, I'll take the blame. That's mine.
But I think this is important.
Covered on
The non-white people coming in are basically new entrants who come in with basically nothing or have nothing. A lot of it's cultural. So whereas a lot of white people been here for a long time, generational. Okay, I'll stop.
Now we discussed citizenship.
No, don't go there, please.
Well, come on now, let's get the show on the road. Okay, it's 8:15.
As a different perspective here, but the approach we're taking doesn't seem to be moving along really well.
Well, it wasn't until somebody.
Yeah, well, I'm sorry. Okay, so any other comments on 2?
Not on 2,
3?
yes.
Okay.
Just one quick question, this is to staff. Why did we change, like, the rural land use and move it off separately from the land use, everything else?
What did we say that
In
again?
other words, we got this land use title, and we have things in there that are urban areas and urban related, and we have things in there currently still that are rural, but then we create this rural and natural environment, whatever chapter. Why did we do that?
Rural is a required element.
No, you get that. So I mean, so that's why we just decided to keep it separate and. Because it seems like we got a lot of overlap of. This is kind of like big
Because
picture,
they're both required and they do have overlapping.
okay,
It's just kind of a nature of the beast of the state requirements.
I'll leave it at that then,
It's a good question.
I'll keep moving along, go on.
Do the table 3.5, and I think there's this happens to be Allen UGA zoning acreage and potential dwelling units. So we have, 156 unit or 156 acres that allow 4 dwelling units per acre, resulting in 624 potential units. How many of those acres, this is simply taking the acreage within the urban growth area, multiplying it by its capacity, showing what could be there. Am I interpreting that correct?
Yeah, potential dwelling units.
Okay, so let's pretend for a minute that 56 of those 156 acres are actually still 1 acre lots with only 1 dwelling unit. It assumes that 3 more would be put onto that acre somehow.
Good question or observation.
In the
Yeah.
past, in the
My-
past,
my-
in the past, it's been that thought.
Yeah, well, my real question is how many of those acres, yeah, I mean. I understand in a perfect world, this is the capacity, this is the potential, that potential exists. But if we have an acre broken into 3 1/3 lots. We have a house on each, but it's, four houses per acre. It assumes that we're re-wickering the land and putting a fourth house in there. What's the real still to go capability of sort of vacant land?
I get what you're getting at, and that's why the state has a buildable lands counties, and I think there's Kings, Snohomish, Pierce, Kitsap, Clark. It's the big counties, and they're required to do a buildable lands analysis that gets to the granular of what you're talking about, because they're so big and they're so grown and they have less lands. We're not anywhere near being a buildable lands county. And when you look at these numbers, it's kind of like, it really doesn't matter. The question doesn't matter, and we don't have the resources. And I mean, the question may matter to you out of curiosity. It doesn't matter for the purpose of the document, because there's so much capacity that we go way beyond the 20-year growth projections. We'll still have capacity. And so we don't yet need to worry about the question you're getting at.
Okay. Thank you, that answers the question.
Okay.
Jeff?
Uh,
Or
yeah.
anyone else?
There's another, okay, this is kind of an overarching thing. I would like to see the same numbers, if you're talking like Shelton UGA, I'd like to see the same number everywhere. Not different numbers in different places.
An example of that, what do you mean?
Well, I'm trying to find, but for example, one part has like 5592 in the total, like on
Are you
page.
talking houses, people, what are you talking about?
No, acreage.
So you're looking for consistency.
Just in general, I like to see charts throughout this document be consistent. In other words, you should be able to look at any figure or any table, and the denominator and all that should be roughly the same.
Yeah. Or
There-
if they don't, there's. an
There's
explanation of
then
what's
there's a little
different about
note.
it.
There's a note at the bottom of the table that says why. And that's it. And then we can never have to ask the question again. We got the answer.
Okay, yeah.
Another thing, layout wise, we got like these 4 or 5 different components, i.e. Belfair, Allen, Shelton UGA, Shelton City, and the county. I'd like to keep that all the way through this document, because there's places where we combine Belfair and Allen,
Okay.
Yep. They need to be separated.
and they need to be separated out.
And that will become very critical as we move through Belfair and Allen with regards to sewer.
Yes.
How many homes in which area?
I'm going through section 3 here. Hold on one second. Go ahead. Chapter 3.
Greeny, Bob. I don't.
Answer that question. Page 40, chapter 3, at the end there, we describe what's going on in the chart above, but we seem to omit the new factor, i.e. the 2010 through 2020 factor, where growth is, it's like we only keep the chart from 1960 to 2010. And we don't talk about the fact that we only had 8.3% growth in that decade, which is either the second or third slowest growth ever in this county, percentage wise. And realizing when the county's smaller, that a percentage could be higher when only 100 people come. But what I'm trying to say is it's a consideration of what's going on in this market. Okay. Chapter 3, page 41, table 3-10. We had this additional, this is a population growth projections. So I have a couple questions. We have a 2022 EIS showing that we're gonna bring in at least, 5,000 more people into welfare. Yet, and we can work backwards for the dwellings and but here we're showing 296 over that time, over this next 20 years.
Well,
So I mean, to, if we have a document, so I guess I'll ask this question too. We have this 2022 EAS of welfare. Are those numbers, because I have not seen those numbers much in any of this planning document.
We can go back and make correct, just like review
Okay.
and verify, and I dig it, yeah.
So the table 310 is based, like, it's projected based on its past trend,
You're right,
past trends.
but
But yes, it doesn't, we don't have a preferred alternative table in there that talks about,
because you had a preferred table back in 2022, you had like 3 or 4 options and you picked one.
Yes, and it was an alternative
Right,
C or D or something.
yeah,
But and was that showing the was that the potential? No, because we have more potential. So
yeah, no, this is showing growth.
that it was a 20-year growth. I can't remember on
Yeah.
the EIS please.
and what's that growth in the rural areas?
And this one?
Yeah.
46%. 6, well, let me ask what, 63,
Yeah.
6,300.
Yeah. But here, this is showing a growth of 6,300 people in the rural areas, or 43%, and then I flip to 411, and it says in the rural county, we're only putting 26% of the new homes.
because you're talking about table 311.
310 and 411.
311, really, that's a very confusing table. I can't make sense of it. And I think there's a digit that's off on top of everything else. On 3-11. Let's just say this, so we don't bog down in this. Tables at least 310 and 3-11 need to be reconciled with the other documents that the county's approved.
It needs to be reconciled with 411 also,
Okay, 411.
because that tells you where the homes are going.
Yeah.
And theoretically,
I
the
don't-
population.
I don't have it in front of me. I can't-
No,
I can only look at 2 pieces of paper at once.
This one though.
Right.
But anyway, you get the general drift, and then I'm just saying 3-11 is just hard to understand what we're trying to point out here. And I think there's an error, there's a number under population. So we have population total, and then we say population and households, what's the difference?
There's typically fewer households than the population, like there's, say 4 people in a household versus the total number of people.
Say that again, that didn't make sense.
Population is just counting the number of individual people.
Yeah.
The households, how many households will it take to?
No, this is saying population in households, so I'm assuming it's
Okay.
people in households. And I mean, we got a number right now for 2024 that's 1,500 less than the population, but in 2045 we have it flips around the other way. We got almost 9,000 more in households than we do in population.
That 91,000, that's a
Yeah,
typo.
381. That's a typo.
81.
Another typo.
Yeah.
I think that 14,518 number is supposed to be 2. Or maybe that's probably a typo also, I don't know. Anyway, okay. You get the drift.
Thank you.
I noticed some of that a few months ago, and I mentioned that, that some of the numbers do not seem to hang together internally.
Um,
Going.
I'm sticking with chapter 3, table 3-12, historic population. Is there a reason why we didn't put anything in 2015 to 2020?
That this needs to be filled in.
I'm not certain if that was just left out, so thank you for pointing it out.
Alright, just for the note, there was 18, almost 24 months, starting about, a year and a half ago, a year ago, where population, the number of number of dwellings in Shelton did not increase, it actually went -1. So just, little food for thought. Where's the driving?
Jeff, on
Yeah.
table 3-11,
Yes,
so 14801, I believe that's from the 2024 to 2045 population
Yeah.
increase. Because you're right, I've been looking at the numbers and they're changed a little bit based on 2020 or them or the 2024. But if you look at that population increase side, we're subtracting the 283 from less group quarters, which is how we get to the 14,518
okay,
population increase that's in housing, because the other increase is considered to be in the group quarters.
okay.
So those numbers do add up properly if you fix the 91,345 to 81,345.
And it might be a matter of trying to describe it.
Well, there's two things. This chart's trying to do, I can see it trying to do several things simultaneously. Most of it's working with population, but then all of a sudden it switches to dwellings. Down in the corner. Or down the bottom there. But that's, I don't know, maybe that works out. I can't do it fast enough on the fly. But. Okay, we got the blank.
So these comments, these types of comments, can you provide them?
I can,
Okay, I'm just,
I know,
yeah,
I know where you're going. Question. Chapter 3, page 44, this acreage with, was 6,000 acres and then and approximately 20,000 acres. This is the second to the last paragraph, and the Green Diamond Resource Lot Retirement. Should that not be a separate zoning?
Yeah, that's something that I've talked to Green Diamond and I'll follow up. So that would be a development regs change as far as changing the zoning map to reflect something unique for that.
Right, but I mean, you're taking 20,000 acres, well, 26,000. Basically.
Yeah, so
Okay.
you will likely see that come
As another,
as a separate thing, but yes, I've been working on that for a couple of years now. Waiting for this comp plan update.
okay, fair.
Yeah.
in the interest, we have 231 pages, we're on page 40.
Well, what do you want me to do about it? Right.
Uh,
I mean, I could stop and
Well, I'm assuming you provide these to staff.
I have not, I worked on summing it up today. On a sheet or two. If you want me to go at it that way, that's fine.
Well, I'm trying to figure out, I could see us here for another 2-3 hours.
That's
I-
longer now.
I promise that.
Well,
Okay, so.
no,
Then
I get,
what the plan is, then.
well, no, I'm trying to.
If you say.
Do you have a summary, if you will,
I
my
know.
chapter? Okay.
No. Not something. It's written, no. Best answer. And I'm more than happy to put this in and send it away that way. I think part of the problem is you have a large document. Part of the problem is some of the things didn't get corrected, we talked about. Some of these things I've discussed several different times.
Yep, I put repeat comment repeatedly.
Yeah. So.
And if I can just dump for a minute, I would make the following observations too. You get into utilities, sewer's inadequate. I now have 5 values for the capability of, the Belfair sewer plant. This says 125,000 gallons a day. My commissioner says 250. Public Works says 1 million, along with the public administrator. We have 500,000 in UIS and 400.
And you notice one thing? On one of those tables, we're using the 125 number. That means we're topped out.
Well, no,
nobody's.
we actually still have excess,
No.
because we're only using half of that.
No, but the permit and stuff. The plan was for 125.
Yeah.
So they have to update the plan. So they have to show the cost, they have to go after new licensing with the ecology. Yeah.
And I think that's, so
What, another way of
We-
summing,
we're-
I'll sum it up a little differently. With the populations and the allocations, assuming we get those all balanced out and squared, okay? We still can't tell by our capital facilities plans. How much more we need, as a county, need to invest or build, or developer has to build. To support those populations. As a classic case, my understanding is when you designate UGAs, there's the intention of bringing urban services to those parcels. We got sections in this, especially in the Shelton UGA, but other UGAs to a degree, where there ain't a snowball chance in hell we're gonna get them there in the next 20 years, and we haven't done it in the first 30. So why are they still in the UGA?
So that is correct. And so 30 years ago, when the state required us to do this,
Yes.
I was in a jurisdiction in Eastern Washington, and the mayor of that city wanted this huge boundary. He just wanted it all. And so we had this huge urban growth boundary. And then, when years down the road, when we're faced to sewering it all and you can't do it, whatever.
Correct.
So it's people's ambitions and then
Yeah.
faced with reality. But then, the state doesn't make it all that easy to reduce your urban growth boundaries, and there's a lot to it. So yeah, us planners, we wrestled with this all the time, and we're never gonna get it perfectly, and so,
I'm just a ballpark guy.
yeah.
In other words, what I'm saying, just like the
I
plan.
guess planners were really comfortable in the gray. It's just the life we live in, and it's the life we go, and we don't build anything, we react to developers
sure.
come into our door. And so we're comfortable in the gray. Now, when it comes to the utilities chapter and capital facilities where DCD doesn't have any purview over that, it's our
Right.
public works department. Marissa and I have very limited ability to get out of what we need, want to get out of them. And so unfortunately for you, Jeff, you'll have to take this up with those outside of this room in order to be satisfied.
And I have.
However, we also know that the state has, over the decades, adopted our comprehensive plans in worse states of affairs than this one is today. And it's nowhere near perfect, but we're trying with every adoption to get more information and better, but
Okay,
so
and
we're comfortable that it will meet the state requirements.
get-
You have higher standards.
yeah, I get that, but there's a statement in the RCW that says, as far as people in your position or in planning. All they need to do is phone, so to speak, phone and email the different parties. And if they don't get it, you don't get it. You make your best faith effort to get it, but then we note that. I mean, there's no way in God's earth, where we're gonna be cost-wise to develop it. My gut feel is based upon the population, we don't have the money or the resources to do what we need to do. But that's another story down the road.
Well, let's jump to table 9.5.
State of affairs.
Table 9.5 is North Bay Case Inlet capacity 0.365 million gallons a day. Current usage 0.27. Future usage
That's 75%.
roughly. Future usage TBD excess 0.088. My question is, why can't we take the expected household growth along North Bay, call it Allen,
You can.
and multiply it by 155, that's how many gallons per day for sewage,
plug that number in there.
Basically, you can take that number and divide it by 200, and you got the number.
Yeah.
And
But
we're
we-
digging deep again, guys.
Well, no, but my question is the next one's the same way. We have electrical in here that says we're gonna increase population by 20%, or decrease usage by 13%. We're gonna add electric vehicles where, the state's headed down, no wood, no gas. It doesn't make sense. And we've asked where the numbers come from, and it's silence.
We have PUD online right now, so if you have a question for PUD.
That's one of the PUDs.
Which one?
Left, of course, and it's with Mason PUD 3.
Okay, so is that Miss Isman? Is that the right person?
Sheila Porter.
Oh, Sheila.
Yeah, I'm still here. If you do have any questions, I'm
So-
listening in. It's just the sound just kind of dropped out there for a few seconds. So if you asked me something, I missed it.
All right, so the question is, in the comp plan, we show 26% growth in population and a 13% reduction in total electrical usage for that same population. So we go from 100 people and 100 kilowatt hours to 126 people and 87 kilowatt hours to support those 126, along with any other mandates in the state, such as electric cars and possibly the removal of wood and natural gas as heating. It just doesn't make sense to me. What am I missing?
You're not the only one who would say that doesn't make sense. So there's a lot of different resources and groups and organizations who are looking at all those numbers. Bonneville Power Administration is one of the ones we use the most to do a lot of our projections because they're where we get all of our power basically is through Bonneville. But there's another group called the Northwest Conservation Council. It's a longer acronym than that, but they release a lot of numbers. As another Pacific Northwest Utilities Conference. They have projections every year. There's a resource adequacy group at the state and regional level. They're looking at all these numbers. It's extremely complicated, and it changes every year. We use the best numbers we have at the time. Plus, we have all kinds of targets for energy efficiency. So if we're able to get more people to better heating and cooling or better appliances, there's your savings on kilowatt hours and that sort of thing. It is an extremely complicated situation. We work with whatever numbers we can get from these large organizations that we're part of. But those numbers do change every year. And when we look at electric vehicle adoption and things like that, which are a whole other factor that we can't totally predict, that's obviously different in certain areas than it is here. We don't have a huge adoption rate here. Maybe no surprise. We also don't have as much natural gas here as in some other cities and counties. So maybe it's less of an impact for us specifically, even though it might be larger at a regional level. We really do go with extremely, I mean, guesstimates, estimates, the best that we can based on how things have been moving, but things change all the time. And new sources of energy may come online in the next few years that we're not sure of. So there's so much out there. I don't know really how to answer the question other than to tell you there's so many different factors.
Well, I guess I would sum it up this way for me is, while there may be new sources of energy, and that certainly would be exciting, it really doesn't, it's irrelevant to the discussion because it's about usage and what we're going to use. And so what I'm hearing is we're going to ramp up demand to 126 people from 100, but we're going to reduce total usage from 100 kilowatt hours to 87. So roughly, 35-40% reduction in electrical usage overall. And
Yeah.
I don't know, I guess it's a really good light bulb and really good HVAC and really good appliances that are all going to get changed out in the next decade or two.
Yeah, and just to clarify a little bit, there's been a lot of push in energy efficiency and a lot of adoption. Generally speaking, we spend over our 2-year contract periods, we spend $1 million, maybe $2 million in energy efficiency incentives. And in this last one, we'll be spending over $7 million in Mason County homes and businesses to help towards that effort from Bonneville funds, and from state grants and federal grants as well. So there are other programs coming out that have been helping to move that faster.
So have we seen, potentially as a result of that, a total reduction in electrical usage?
Absolutely.
Sheila, Jeff Carey, another one of the PAC members.
Yep.
One thing, first of all, I'm like Will, I'm having trouble buying the numbers. Two, I saw some reports were given to me by one of the PAC members a while back. That was a meeting or presentation to the League of Women's Voters and documents provided to them. And, you know, to me, it seems like you have, the PD has the data because they can see that substations, 2 or 3 of them are going over what they're designed for and having to be re-engineered to bring more capacity in. So on the one hand, we see things going up in usage, and yet we have a chart that's showing going down. And yet, taking Bonneville, I've looked at Bonneville, and you know they're not looking at less capacity. They're trying to figure out in the next couple of years add another, you know, in their mind 6 gigawatts to the system. So all the parties I see so far are going up. Nothing's going down, and so you know somebody needs to address that because it just doesn't. It makes it impossible to plan what you're going to need. And then if that's the case, then why is the PD spending all this additional money for grid upgrades if we're going to need less power? I mean, they're going to spend $12 million up in Belfair.
Yeah, a lot of that stuff is old. It needs to be.
No, I understand some of it needs to be replaced, but what I'm getting at is they're talking about capacity increase and things like this. Yet we have charts that show, or that would have been presented, that are showing less. Anyway, that's one of the concerns. Thank you.
Yeah, and I'm trying to find the chart that you're referring to specifically, because I'm kind of at. I'm not sure if I've got all the same documents that you've got in front of you, so I'm having a hard time referencing exactly what we're looking at right now. I generally understand which one you're talking about because I remember looking at that and running it by our people in our conservation district. And you're correct that overall we're looking at an increase in capacity and needs. From what I understand is when it comes to our savings and conservation, I'm trying to figure out the best way to explain the math here because we are increasing our efficiency, we are saving kilowatts. We can see it on, you know, individual bills in particular or individual usage in particular. But you're absolutely correct in that overall in the system, we see more use and we will see more use based on added demand rather than if we'd had the same number of customers in 5 years, say we just for some reason had the same number of customers in 5 years, would we be saving a percentage? Yes, we would, because we're moving towards more efficient systems, more efficient appliances. But aside from the baseline number, that increase in capacity is what we're building for. In general, generally speaking, for each individual household, we're hoping we're saving energy, that 10%, that 13%, whatever. But overall, for the entire system, we are building for increased demand, increased needs. And then, of course, as you mentioned too, electric vehicle adoption can throw a lot of that off when it comes to the math. But since we can't plan that for every single household, right? Right now, we're just talking about normal moving forward all things as they are, we're going to save money in the individual cases and the baseline, but we are absolutely going to see more demand overall, which is why we need these big projects, which is why we're going for, state and federal funds, and system fees and things like that to be able to build out.
You look, if you would, do you have a copy of the draft comp plan?
I do have copies of the draft comp plan, yes.
Table 9-17 on page 161 shows us dropping from about 531 million kilowatt hours to 478 in 20 years. And, if we're going for state and federal funds, we might want to just revisit that table, because what I'm hearing you say is that number's going up from 531 million kilowatt hours, not down overall. And this table is saying the opposite. It says it's going down.
Sorry, could you say the page number again? 161?
161.
Table, let's see.
9-17. So
I have it on page 163.
Yeah, I'm seeing it 163.
Okay.
Table 9.17.
Version control.
It's Word versus the PDF.
Right.
I knew Word, you could be in PDF. Yeah, fair enough. So, but that's something we'll just.
Yes, I see what you're saying. Yes. I can go ahead and look in that one again. Yeah, I'll double check it. I'm not sure all the numbers that go behind that, because I'm not the one who prepares that table. I'm just the one who pushes the numbers forward. But I know who does prepare that table, and I will ask them specifically that question, and I will get back to you all on that.
Well, and very importantly, it could be the assumption unstated here in the document behind the table. And that's fine, but when we read the table, it just says it's not making sense.
Yeah, and I wonder if it's more related to the paragraph above where it's talking about renewable energy targets, but then the table itself is named electricity demand. So that's where I'm wondering if maybe there's some naming that we should look at, because maybe that's not what we're talking about.
So when I look at utilities, I just try with the 3 UGAs, skip the entire rural area. Power, water, sewage. How much do we have to, what's the capacity? I motion that we extend this for 30 minutes.
So the chair is moved to extend another 30 minutes. I'll second.
All in favor?
Yes.
Aye, thank you. I look at power, water and sewage, and I don't see what's our current capacity, what's our future capacity, what's the delta? Is there a deficit or a surplus? And I think that's absolutely critical. And that's just the 3 UGAs. Rural at this point, I'm really ready to ignore. I don't think it should be, but I don't know what to do with it. Yeah.
Yeah, no,
There's too many moving parts.
first of all, if like, okay, take rural, take the issue of water. You got these water resource inventory reports and what have you. Fine, you don't have the time to pull it all together, fine. Then reference the summary guns and put it in so that we have, and links so we know where these reports are and can later address it. Because, I'm looking at like the wire 14. I don't think that data is correct. Because I ran a water system and the water usage that they're talking about here is more like an urban level. And the only places you're gonna have public exempt private exempt wells are gonna be more or less in the rural lands. And there's no way, on average, a rural, most of them are gonna be 2-party wells because they're sharing costs.
Yeah.
As an individual, there's no way you can run at 157 gallons per day.
Yeah, what are you talking about? Where?
Page 63, chapter 3, wire 14. I just would say, reference the reports and cycle them in that way, because I don't know what the reports say, but I'm saying I'm looking at this data in this,
It's directly from the Department of Ecology.
they're nuts.
Well, I mean, yeah, and
It's not, it can't be.
Prepare for the lightning bolt.
yeah.
That'll be fine.
With capital facilities, we still don't, a lot of these don't have a timeline. We definitely, I would request staff to revisit no additional admin space for the county. I'd like that just verified with our new county administrator.
You suggest a policy.
Oh, geez.
Done.
Suggest a policy because that's the only way it's gonna happen.
Okay. Let's move on to climate resilience, if I
Can
may.
you take a note on that, and make sure it happens?
Oh,
Did you bring up table 410 or figure 4-10?
I think that was reference, but last month.
Yeah,
It's different.
again, it's just, if you look at housing units, they don't reconcile out with other charts.
right.
I'm pretty sure you mentioned that.
And-
previously, but-
Right, and
Yeah.
one last thing on that, and I'll drop the rest. I mean, when we say that we're gonna increase the population by 418, we're going with the 2.54 number, right? Generally speaking.
Sorry, I was looking at the
Okay,
page, say that
sorry.
again.
When we deal with the county's population, not the city, well, is it 14,800 county only, not city? You gotta make sure, we're up from the map. Is the 14,800 some, is that only the county? And the unincorporated UGAs? Okay, we'll just park it there for a second. I'm assuming we're going to go with 2.54 population per dwelling. If you do that, that means you only need 5,827, not 7,037 or whatever. And I don't have a problem with the discrepancy, but then define, put a note that says, this is why there is. Please. Okay, go ahead.
Climate change stuff there. Yeah. Hang on. This stuff's in. Yeah.
Thank you.
So the climate change, I would really like to see minimum requirements addressed. So all references to 2020, 2100 impacts removed. Remove earthquakes outright. There is an overarching, in my opinion, I really appreciated, Sharifa, your comments on the risk factors largely were pulled from the hazard mitigation plan. So those risk factors sort of carried over. But that's not, I didn't see that statement. Again, there's a lot to read, so I could have missed it, and I'm happy to mark errors. You're on mute, so I saw your mouth move, I didn't hear anything. Just want.
Yes. Can you hear me?
Yes.
Okay. I don't believe we put in that statement directly, but it's definitely something that we can add in, that those were coordinated with the ratings that are in the hazard mitigation plan. So what we've done is that Commerce in their workbook and the workbook that's in the appendix, they have a methodology for us to look at the ratings. And just assess the sensitivity and then assess the exposure. And based on those, we get the result for if we want to rate the vulnerability as high, medium, or low. We looked at the different factors that Commerce advises us to look into in developing the sensitivity and exposure. But then, looking at those again, we could use our gut feeling based on those answers because it's an assessment. It's not scientific in that one, but we took our gut check, but then referenced the hazard mitigation plan and made sure that what the scoring that we're giving is equivalent to what's in the hazard mitigation plan. I do not believe that in our chapter we stated this. that these are coordinated, the ratings are coordinated with the hazard mitigation plan, we can absolutely add a statement that notes that. Because we reference the hazard mitigation plan throughout the chapter in general. So this would be just another instance where we do reference the coordinated results of the ratings with the hazard mitigation plan.
So I'm gonna say this, let's make sure I don't get too many arrows coming at me. So what I'm hearing is the ratings basically are similar to the hazard mitigation plan. Stated another way, climate change does not make a major impact on those factors.
So the hazard mitigation plan looks at the similar aspects that we're looking into. It looks at the drought, it looks at the extreme storms. They have the umbrella as extreme weather. I think I don't remember the correct terminology, but they have extreme heat, extreme storms, extreme all that all together. And even flooding, I think, falls under the same thing. But they look at the similar hazards that we're analyzing in this document here. So there's a lot of information that we pulled from the hazard mitigation plan. The hazard mitigation plan and their rating, for example, they have extremely high vulnerability. In the commerce recommendations, they don't have extremely high, they just have high, medium, low. So whatever is referenced as extremely high, we just used high. Whatever is medium, we kept medium. Whatever is low, we kept low.
Well, so when we look at all this, and let's just talk about extreme heat for a few minutes. And, I've used the example, but I'll just take it. Let's go to your native country. I've been to Kuwait in the summer. Let's say it's warmer in Washington. And so I think that's fair, and I think you can relate to that very well. It's also a different humidity level, much lower. Okay, down the coast a little different. But there are some factors. And so when we start to talk about extreme heat and factors, I look at some of these challenges, and we have policies in here to specifically look and be sensitive to and protect our workers. And I struggle with that only in that labor and industry has standards already out there for that, that has work break cycles, has cooling cycles with a defined cooling area, 80 degrees or less, has hydration requirements that are already in there. Are we saying L&I standards are inadequate for our workers? And are we really saying this climate is so horrid in the summer that we have to take these measures? This is where I'm struggling because, and
I'm happy to address your question. So if just going back to my native country, the infrastructure is built for that level of heat. Mason County's infrastructure is not built to withstand that level of heat that is increasing, becoming more frequent. And then there are accommodations, absolutely, as you mentioned, for workers to protect them. But the idea is to look at ways to codify them. So if certain businesses pull those or things like that. So for instances, when the state has certain requirements, we try to defer to the state because, we're like, hey, the state has requirements, we trust those. But we need some level of codified requirements that industries can meet or exceed even. But what we're suggesting here is to have some level of codified protections against these elements that could put people in hazardous situations. So yes, absolutely, some industries are doing those proactively, but some may not. So what we're trying to push here is that for those industries who choose not to, the county would be the proactive party in setting together some minimal standards to ensure the protection of those workers. Because again, and just going back to my native country, because you mentioned it, in the months of summer, there is no outdoor workers working during the day. They work overnight to the early hours of the morning, and then they break it. The hours shift. But that's a way more extreme climate than in Mason County. So that's not necessarily what's needed in Mason County, but just to put in some requirements and references that will ensure the protection of workers without relying on industries to set those standards. That's what we're trying to achieve here.
as a company, can I ignore L&I? Well, that's what I thought.
At your peril,
Yeah, that's what I thought.
right, Jeff?
Right.
Yeah, well, and
I can,
and those are my thoughts, is that,
okay.
you know, there's the eternal question in climate change, whose best science?
Just out of-
No, I don't want to go there, but
Just
it is no.
As a curious stat question, why like in the rainfall did we go with a different organization versus NOAA or National Weather Service? For like rain totals, because I'm looking at that chart and I don't think that chart's right. I mean, because
I did see, yeah, I did see your note on that, and I was doing a little bit of digging in. And because that chart is referenced from NOAA, but then the other chart highlights Mason County. The chart that we had in the report actually just utilizes a specific station readings. So I think the discrepancy is from there, but we can definitely revise those and just like pick what we think is more appropriate, which I think countywide is the more appropriate for a document like this one. But I was trying to find the discrepancy because the source for that is also NOAA, the one that we have in the report.
well, it says state of Washington climate or something.
Well,
Yeah, but when you go to that, I went back to the resource of that website, and it is the chart itself is from NOAA. And I'm happy to send you that webpage where it references it just for your information. But I agree with you, it's a great catch, and it just we're happy to make sure that we're using the best charts for this. The one that we were using was for a specific station. And we'll look at something that's a little more broad for Mason County.
My recommendation based upon history is use the airports.
well,
Mhm.
if I may, so if you look at the spreadsheet I sent, you'll see 3 charts, okay? And so first, Ralph, let's go back a century, not a decade, and the data's there and it's provided.
Well, you were using a standardized precipitation index, and that doesn't cover nearly as many variables as the
No.
US drought monitor. And when climate models have been showing that we're going to receive, on average, annually, the same amount of rainfall, but concentrated in a fewer amount of months.
Sure.
You wouldn't expect to see it very much show up on the standardized precipitation
Well,
index.
And I think though, that's absolutely key, Echo, is that in every one of these charts, it's like I threw one out precipitation. It happens to be one data point per week or per day, you know, for the month of February, okay, over the years. And if you go to the month of March, it looks a little different. And that's what's so critical is which data set do you select and what assumptions are behind it and what's the rest of the understanding? And you look at, you know, like there's one in the report, you just go, that just looks wrong.
Rainfall one, I agree.
Yeah.
But those look wrong. It takes it out of context.
Yeah.
But the average temperature chart, I spent a good hour.
No, they have-
I spent a good hour and a half on that website a couple days ago.
Yeah.
And I struggled to produce a graph that didn't produce a mean temperature increase.
Yeah.
No,
Yeah.
I agree on that.
No, but
And in your
that I
graph,
think
it's you
needs to
selected
be.
May
Yeah.
in the one that you chose, and it doesn't show warming.
No, I pick one. You can pick any one you want. I mean, again, I do not propose what I put in there is right. I'm just saying I can't, I'm struggling.
Okay.
All right.
Yeah, and I hear you. And maybe one thing that we'll try to note is in the descriptions of the chart, note all the assumptions that are embedded in whatever charts we end up using in the report. So this way it's very clear.
That'd be handy, at least the assumptions.
Well, and yeah, a list of all assumptions and the glossary of terms in this. We've talked a lot. And I'm not sure what the next step is. Bob, you've been very quiet all evening.
Who's for today?
Thoughts?
Well, I can be my grumpy old self like I usually am, but there's a lot of stuff here, and we're all technical weenies, we're all picking it apart. And you'll note that staff, specifically Kel, ain't very happy with us being so picky about things. You know, she's pointed out that the county commissioners want to do the bare minimum. And we are definitely going well beyond the bare minimum on a lot of things. It's been, quite an experience learning all this stuff. But the bottom line, we have to, get something done. You know, it would be nice to be able to actually meet a goal, on a schedule, a deadline, drop dead date. And we have not done it.
Well,
And I have no idea if we ever will,
who's the we?
us collectively.
Very
We have a
nicely
consultant. We have staff. We have the PAC, we have the commissioners,
We have the public,
of course.
all of them.
I'm listening to all this stuff and I'm thinking, how much BS are we really talking about here? I don't know. But we're updating something that's been done every 10 years for a while, and it's still, they're trying to put lipstick on a pig.
The one disagreement I would have is that we've never done the capital facilities correct, not even close. We've never known. And so to say, I don't disagree that we haven't passed it all these years. But you can't honestly look at this and say, can we handle 14,000 people? You just can't.
I mean, gut call feels that way,
Agreed,
but just pencil it out.
agreed. I mean, we have actually seen that real data that shows we are actually exceeding the number of single family dwellings being constructed on a yearly basis. That is beyond what would be necessary for some time period in 2045. Okay, we're making more homes.
Well, the one chart they got there, no.
No, there's
It's
a
opposite.
sentence, there's a sentence in there saying we're building like 382
Oh, right.
homes a year.
Right,
and you
right.
We're
pencil
building
out
more homes than
8,
this bare minimum
360,
needed
350.
to hit that number in
But
2045.
the chart doesn't show it. That one chart,
And
that decade
you
chart,
have confidence in the charts, Mr. Jeff?
I don't have confidence in either number, actually.
So we have to just go with what is our best guess.
My gut, because I do check,
Yeah, you do.
I mean, we have acreage things, it shows 1,700 acres and then Shelton UGA is
Mhm.
Neighborhood residential, there's only 1,600. It's things like that that just drive me nuts when it comes to trying.
Because you're technical, Winnie, you want to be right. You want whatever the heck your name is on to be worthy of your signature, and you want to feel comfortable with what you're doing.
I know I'll never be comfortable there. But I'd like it at least in the ballpark.
Mhm.
Or if we can't get in the ballpark, progress towards it.
So Grumpy Bob is going to shut up.
No, I need somebody to say it.
I know you do.
Randy, back up. You're the new guy, what are you saying?
Well, I'm with Bob, I'm learning a lot.
It's a really big fire hose and there's a lot of pressure.
Every time I look, there's more.
Yeah. Yep. It doesn't stop after a year and a half, by the way.
I wouldn't think so.
No.
Hang around long enough to say it again.
That's exciting.
Yes.
The weird part to me is this seems very simple what to do. I haven't seen anything step that an average human can't do. It just seems like somehow we don't get it done.
Well,
Well, have any of you worked in local government before?
This is my first time.
No.
Okay, well, I have for nearly 30 years, and Mason County is one of the smaller, poorer counties, given that we have 66,000 people, small
Yeah,
rural.
I get
tax
that.
base, very limited resources. So you compete with staff with Thurston and Kitsap and elsewhere. And, you do your best and you try to play along with the other departments and information, but everybody's literally scurrying around trying to put out fires and deal with personnel issues and all kinds of stuff. And every day it's different. And,
in the Department of Commerce's.
we don't have the luxury of, R&D or.
You'll get the kick out of this, In the Department of Commerce's book on capital facilities planning, it addresses the smaller counties and the fact that they don't have the capacity to do these, reports, okay? One thing it says is work with your PAC.
And
And as anybody, I've talked to, Department, Public Works. They seem to agree with me, but they don't produce anything.
Okay, well,
But then
how are Marissa and I supposed to deal
but
with
then
that?
we note it and move on,
And
and we haven't noted it, and we haven't moved on.
We are moving on.
Yeah, okay.
That's
That's
a
right.
motion to do a 5-minute break.
All right,
How are we doing on time?
Yeah, 7 minutes left.
why are we waiting?
All right, yeah, that's good.
One last thing, there was a reference to House Bill 1717 with the tribes. Is that something, I mean, is the tribe supposed to be looking at this and have they given their input? If they are?
I submit it to the tribes for review, yes.
Okay.
If you go on the website, there's a 130-page document from one of them, give or take.
Super.
I'm just struggling. I'm struggling in the sense that in a month, we're gonna be asked to give a recommendation. And right now, I can't. My recommendation is don't approve this. Because there's just the simple gaps need to be filled. Electric, water, sewer, and the UGAs. And in the Belfair UGA, like it or not, folks, 160,000 gallons in from an industrial complex over the county line. And I say that because the county commissioners have approved the supporting project for that for the past 2 years. Show us that we either have or don't have the capacity. And I think we're gonna find we're just fine. Okay, but we need to verify that for our own community.
See,
And
and
then the board of commissioners make their own decision. Whatever they decide is fine. That's their business. We just show what can be done or what can't be done. And we being the big we, staff, contractor, public, PAC. But we provide that to them. And I don't think that's that hard to do.
No.
But simply asking to break out of Allen to Belfair as 2 separate communities is like pulling teeth. You know, the climate change, the tone is very alarmist. It just is. I've had a couple of folks call me and, we have some very difficult, challenging topics in there. When we start to go in and say, we need to, think about earthquake loadings. So you're telling me the international building code is inadequate for Mason County? Really? Is that what we're saying?
No, that's not what we're saying. We're not saying that building code is inadequate. We're saying there exists a lot of structures that need repairs and reinforcement. So in the case of an earthquake, which there's a lot of fault lines that go through Mason County, that those pieces of infrastructure are able to withstand a level of earthquake shake without severe damage. That is the intent of this document. And I just want to frame it again that we're not trying to fix climate change here. We're trying to be prepared when extreme events take place, that the county is able to recover quickly without a lot of damage. This is what we're trying to do. It's about addressing the preparedness and our resilience against extreme climate events that are just recurring. And in cases where there are regulations and building codes and things like that, we made sure to refer to the state requirements and say, whatever the state is requiring, this is adequate. But just to say, hey, we are encouraging certain jurisdictions to review their pieces of infrastructure and ensure that they are able to withstand a level of storm, a level of flood, a level of earthquake. And I did see a comment about removing the earthquake section altogether.
Yep.
We can discuss that definitely. But the idea of this document is preparedness against weather events, climate events that happen. That's the objective of this document. It's our resiliency against climate hazards. We're not trying to fix climate change through this document.
My concern right now is moving forward. We have some fairly big comments and we're 2 weeks out in theory from public hearing. Are we really prepared? And we're missing an element of pretty important one.
Well, supposedly the transportation is gonna be available soon.
Next couple of days.
I'd say for as far as, public discussion or hearing and all that, I don't see any problem with that even not being fully done. Because we'll see what's triggering people.
Yes, there's gonna be a big ping pong game between
Big-
the VOCC and Commerce.
So, I mean, so I'm saying that next step, I don't see a problem. Getting a little, then incorporating that, I don't see that to be a problem. Working that, it may turn into.
For days, my friend.
I know,
Well, I mean,
but I'm saying,
I'm assuming the version we're looking at is the one for public hearing.
No,
We're gonna make edits based on today and any feedback you send to the next day or two.
Okay.
looks like I better get my butt in gear and get this finished.
I think it's safe to say you're late.
Yes. Okay, well, anyway. So as far as moving forward. We agree that, we can move forward with a public hearing.
Yep.
And then, we're gonna see, we got that meeting at the 29th, right?
Yeah, we have a meeting in, I believe, 3 weeks, whatever the 14th of September. 15th of September, public hearing here, 6 o'clock, followed 14 days later. By completion of the public hearing, if required,
Right.
preferably, hopefully it won't be,
Right.
then deliberations.
Deliberations is not a problem.
We've proved that.
As long as it's a big.
Either way.
All right,
Would you, logically, you deliberate and come out with a decision, no matter what, we can do.
Next is Outer Mountain, Olga.
The results we may not like. But. Anyway.
trying to figure out how, we'll have to figure out how to summarize all that and then how that gets presented to the BOCC.
Yep. So would like me to make the motion?
Any other closing comments, members? No. Motion sounds good.
Yeah, make the motion to adjourn.
Second.
All in favor?
Aye.
We're adjourned. Thank you.
Right.
By the way, if you ever type in the GPS coordinates in Google, you're gonna put a minus. What's that?
Okay.
Like where you live.
Timer.
You'll be somewhere in